A very good morning to all of you. This is the fourth day of your ROTP, and I'm going to deal the topic related to Basti. So, considering the delegates are being teachers, having the varying experience of 1 to 10 years, I have not gone through the method of administration of either the Niruha or Anuvasana Bastis, or what are the definitions of Astapana, Anuvasana, the classification in detail, all those things I have skipped. And I have considered only few discussion points here, which would be very helpful in the clinical practice. So just to begin with the presentation, are you aware there is an enema monument in the world? It is in Russia, in one of the spas, actually. So the idea is from the drawing, a very famous painting on Venus and Mars, where the three cherubs try to steal the Mars weapon. The Mars is considered as the god of wars, and they try to steal the weapon of Mars. And here, the weapon is being represented by a big bronze bulb, actually, which represents either a glycerine bulb or we can consider it as an enema putaka. So this is the only one monument in the whole world which is considered as an enema monument situated in Russia at Spa Mashuk Aquatherm. So with this I begin my presentation. I have named my presentation as Basti Sutram, an insight on Basti. And this is the area of presentation. I always believe no presentations on Basti can start without explaining why the Basti is important modality among the treatments, or why we consider it as Ardha or Sampurna Chikitsa. The other things include how do we prepare the Basti Dravya, what should be the pattern in scheduling the Basti, what is the time to administer the Niruha and the Anuvasana Bastis, etc. Coming to the importance of Basti Chikitsa, why it is considered as the most important, why it is superior compared to all other procedures, either when compared with the Panchakarma. It is not only in comparison with the Panchakarma, but even when we compare with the Shadvida Upakramas, Basti is always considered as most beneficial one. The reason being, when we look into the qualities of Vata, Vata is explained as Vibhutvat, Ashukaritvat, Anyadapi Dushanat, Swatantrat, Bahurogatvat, Doshanam Prabalo Anilaha. So Vata is always considered as stronger when we compare the other doshas with it being a Vibhu. Vibhu is nothing but it is omnipresent. It is present everywhere in the body, even in the external atmosphere. You can see the presence of Vata everywhere, without which the existence of life is not possible. Ashukaritvat, Vata has this unique quality of being very fast. It is very quick in its action. How do we understand the quickness of action of the Basti when it comes to the pathological conditions? See, when we describe any of the diseases, when we study the Nidana Purva Rupa, etc., apart from Vata Vyadis, all other diseases have the specific set of the Purva Rupas or the prodromal symptoms. So that's why they give a sufficient time for the physician to understand the Vyadhi in the Purva Rupavastha itself, so that they can begin the treatment. So they are very easy to treat. Whereas Vata Vyadis progress to the stage of Rupa in such a fast way or quick that it does not allow the physician to understand the Purva Rupas. That's why most of the Vata Vyadis, apart from one or two, they don't have any specific set of Purva Rupas. So that makes the Vata very Ashukari. Then Anyadapi Dushanat, this is one more unique quality of Vata, that it is capable of vitiating other doshas, or it can result in the diseases of the malas, though they are not increased by their specific nidanas, because Vata being it has a gati to travel, it has the chalaguna, so that even the swasthanasthita pitta or kapha could be dragged by the vitiated Vata to the other sides, resulting in the vyadhi. So it is always capable of vitiating the other doshas or the malas. Then swatantrat bahurogatvat. So how do we understand this bahurogatvat? Just understand what are the nanatmacha vyadis, the number of nanatmacha vyadis either created by the pitta or the kapha. Altogether by pitta and kapha, there are only 60 diseases, 40 by pitta and 20 by vata. But when you look into the nanatmacha vyadis of vata, they are 80 in number. So swatantrat, independently, it can lead to a lot of vyadis. Bahurogatvat, it can create lot of diseases. The one more thing is when we consider the pathological conditions, how the Vyadhis manifest, Vata always has the unique nature apart from being getting aggravated by the own causative factors. It can aggravate by Dhatukshaya, so we have Dhatukshaya Vata Vyadhis. It can aggravate being done an avarana by the other doshas or the malas, so we have the avaranajanya Vata Vyadhis. Apart from this, as this has the gati, it can always invade the other dhatus or the malas, so we have the Gata Vata Vyadhis, which are not noted either with the Pitta or the Kapha. So this makes the Vata the most balina or the prabala among the three doshas. So this is a well-known shloka. I don't want to go to the details of this, but what you have to understand here is tasyati vruddhasya shamaya na anyat basti vina beshajam asti kinchit. There are different modalities of treatments as well as the panchakarmas available for treating the Vata. For example, when we look into the Snehana Chikitsa, in the beginning of the Snehana Adhyaya itself, the Chakrapani makes it very clear why Snehana is kept as the first chapter before dealing with the Vamana or Virechana. He tells, Vatasya Pradhana Beshajatvacha. Snehana is always considered as the one of the best modality to treat Vata, but only when it is not aggravated in excess. This we have to remember. He tells Ativruddhasya Shamaya, when it is aggravated in excess, it's only the basti which is capable of bringing the Vata back to the normalcy. So that makes the basti very, very special. So here he also highlights the Vata can manifest the diseases in all the Trivida Roga Margas, and it is the one which is responsible for either the Vikshepa or Sangata of different dhatus and the doshas, and that's why when it is aggravated in excess, it can be treated only by doing the basti. This is one more reference which tells the importance of Basti. This is from Sushruta, where he highlights that Basti is capable of treating the disorders of all the three doshas. He tells Bastir Vatecha Pittecha Kafe Raktecha Shasyate Samsarge Sannipatecha Bastireva Hitaha Sadaha. So it is not only in the aggravation of the doshas, but even in their permutations and the combinations, when it is the Samsarga or the Sannipata, the Basti is capable of taking care. What is important here is the Rakta, because Sushruta has identified the doshic nature of the Rakta. That is not a part of the presentation here, but still, apart from leaving the doshic nature also, if you don't want to consider Rakta being a Chaturtha dosha, Rakta is always important in the manifestation of the diseases. Vagbhata tells, Yatha Raktam Adhishtanam Vikaranam Vikarinam, means Rakta is one of the very important Adhisthana for all the Vyadhis. So that's why it is considered as most important among the Sapta Dushyas. So even as a Dushya, the Rakta is very important, and when in the Samsarga or the Sannipata, the diseases are manifested. The best example I can quote here is Vata Rakta, where Vata and Rakta are aggravated, leading to a disease, and the best modality to treatment is always the Basti. So that makes the Basti very special. This is one more well-known reference, or usually taught in the classes. It is from the Sushruta. So he puts forth a question. He inquires, Tatra snehadinam karmanam basti karmam pradhanatamam ahuhu acharyah kasmat. Basti karma is considered as the pradhanatama among the treatment modalities by Acharyas. Why? The question is why it is considered as the best. And the reason he tells is it is capable of exhibiting the different actions. And those different actions are Dhoshanam, Samshodana, Samshamana, Sangrahana, Arkshina Shukram Vaji Karoti, Krisham Brumhati Stulam Kashaiti. Look into the varied aspects of the Basti treatments. We have Vatahara, Pittahara, Kafahara Bastis to eliminate either the Vata, Pitta or the Kafa. We have Vata Shamaka, Pitta Shamaka, Kapha Shamaka and Shula Shamana Bastis, either to pacify the pain or to pacify the Vata, Pitta and Kapha. We have the Sangrahana Bastis, both for the doshas as well as when the Srava is happening in the body, either for Rakta Pitta or for the Grahani or for the Pakvati Sara. We have the Bastis where the Bastis are going to do the dosha Sangrahana. Then we have the wide range of Vrishya Bastis, and it has been proved very effective in treating the oligospermia actually. So Kshina Shukram Vaji Karoti, it can always increase the potency of an individual. Then he tells Krisham Brumhati Stulam Karshayati. See, it's very important. From lean to obese, Basti can act. So when we consider the type of diseases and the type of Vyadita or the Rogi, there are only two types of diseases. One is Santarpanotta and the second one is Apatarpanotta. Similarly, Similarly, the deceased or the rogi can also be classified into only two, either being lean or being stula. So the vyadhita, either they are krisha or they are stula. So when you are planning the treatment, you have to look into the patient whether he's krisha and what treatment needs to be planned in basti, or whether it is a stula patient, what the treatment modality has to change. Then he explains valipalitam upahanti vayahastapayati. This is nothing but the effect of rasayana. So always when the basti is properly administered, it endows a person with shariropachaya and improves the bala, varna, arogya, ayusha, etc. He also explains it is chakshuh prinayati. We have chakshushya bastis actually, like the madhutailika basti when it is prepared with yashti madhu kalka. Specifically when we change the kalka dravya, the general kalka dravya in madhutailika basti is always the shatapushpa, but when you make it the yashti madhu kalka, it becomes chakshushya in nature. This is one variety provided by Vagbhata. When you want to compare it with the other available shodhana or the Panchakarma measures, nasya is always useful in diseases pertaining to urdhva jatru, and it has a very limited role in the management of systemic diseases. Of course, this is not like a end line for the nasya, because nasya is used in lot of central nervous system disorders, even including the facial palsy or the pakshagata or the multiple sclerosis, etc. But when compared to basti, which is considered as apada talamurdhasthan, it can act starting from the nail to the hair. Such wide range is not available in nasya. Coming to Vamana, of course, Sushruta explains when it comes to the matter of Shodhana, it's always the Vamana and Virechana being the major Shodhana procedures. We should always remember this. When a person is suitable for Shodhana, when the age is suitable, when he is not suffering from any of the particular contraindications where the Vamana or Virechana is contraindicated, when you want to do the Shodhana, it's always through Vamana and Virechana, either through the Urdhva Bhaga or through the Adho Bhaga. But the problem is, it cannot be performed in Durbala, Vruddha, Kshina, Sukumara, etc. And the procedure of the Vamana, as you know, most of the people don't like it. And the second important thing being the medicines being very unpleasant and they cause lot of discomfort. If you can just recollect the qualities of Vamana Dravyas, it is always Asatmya, Bibhatsa, Durgandha, Durdarshanani Vamanani Syat. So the Vamana Dravya should be Asatmya. So it is not Satmya for the individual. Bibhatsa, they should not look pleasant. Leave about the quality of the drug or the taste of the drug, it should not look pleasant, otherwise the Vamana will not happen. Durgandha and Durdarshanani, Durgandha, it should have an unpleasant smell, etc. So it becomes a very tough procedure sometimes when a patient is not cooperative to undergo the Vamana. Whereas Basti can anyhow be performed in all the age groups, as it is considered as Shishunam, Ashishunam, Basti Karma Amritam Yatha. So Basti is always considered like an Amrita for all the age groups starting from Shishu to Vruddha. This is one more reference we come across in Charaka Siddhi 10th chapter, where he explains the supremacy of the Basti over the Virechana therapy. You can see in the second line, Vireke Syuhu, he tells. Usually the word Virechana stands both for Vamana and Virechana, because Ubhayam Dosha Haranat, because both the procedures eliminate the doshas from the body, both can be considered as Virechana. But in this context, Charaka specifically explains the supremacy of Basti over the Virechana karma, not with respect to Vamana, only with the Virechana. Why? Because both the Virechana and the Basti eliminate the doshas through the rectal route. So both of them are going to act on the Pakvashya. So in comparison with the Virechana, he explains how Basti is superior. He tells, Satyapi dosha haratve, means no doubt. There is definitely no doubt when it comes to the action of Virechana, it eliminates the doshas. It's a good procedure which eliminates the doshas. But it involves Katutikshnoshnadi Bheshaja Danat. It involves the intake of the ingredients which are Katu, Tikshna, Ushna, etc. And during the procedure, either while the patient is taking the medicines or throughout the procedure on the day of Virechana, it is always accompanied with Dukkha, Udgara, Utklesha and Koshtaruja. Whereas, and also, Virechana is contraindicated both in Shishu and Vruddha. Why it is contraindicated? He tells the reason. It is aprapta dhatu and aprapta bhala in case of children, and prahina dhatus and the prahina bala in case of vruddha. So that's why Virechana is not recommended after the age of 70. Whereas he tells Astapanameva tayoho sarvartham kriduttamam karma. Anyhow, the Astapana is indicated in both the categories and it can bring all the results. Sarvartham, it can serve the purpose or it can be used in all the diseases. At the same time, it helps to promote the Bala, Varna, Harsha, Mardava, Gatra Snigdhata, etc. The next reference correlates why Basti is superior in comparison with the Shadvidopakramas. We come across the Shadvidopakramas like Dvividopakramaniya Adhyaya, Langana Brahmaniya Adhyaya, etc. And it has been highlighted by the Charaka as well as the Vagbhata. One who wants to go for the general practice, they should be well versed in Dvividopakrama. Whereas the one who wants to go for the specialized practice, they should be well versed in Shadvidopakrama. And it is considered as the physician who is well versed in Shadvidopakrama is capable of treating all the diseases and he will never fail in the treatment. He can achieve the success in the treatment. But here Charaka explains, karma anyat basti samam na vidyate shighra sukha vishoditvat ashu apatarpana tarpana yogacha niratyayatvacha. This is very, very important if you want to correlate this or if you want to explain the importance of basti over the Shadvidopakrama. He tells ashu apatarpana tarpana yogacha. It is only the basti which can bring up the apatarpana and the tarpana effects quickly. Niratyayatvacha, which is not associated with any complications. So without any complications, the basti can bring up the apatarpana and the tarpana benefits. And also it is Shighram Sukham Vishoditvam. It eliminates the doshas quickly and comfortably, actually. And the second shloka is like a replica of the first. And at the end, like Charaka, this is a reference from Charaka Siddhasthana, first chapter, where Charaka explains, Ushnabhi bhuteshu vadanti shitat, shithabhi bhuteshu tatha sukoshnan, tat pratyanika aushadha samprayuktan, sarvatra bastin pravibhajya yujjat. So the main idea when we plan any treatment, it is like opposite to the Nidana. So that choice is available in Basti. He tells, when you want to treat any disease, try to analyze and understand the Nidana of the Vyadhi. If the Nidana is due to the Ushna Guna, then plan the Basti with Shita Dravyas and vice versa, applicable for Shita and Ushna. And when you look into the commentary, the Chakrapani tells this is not applicable only for the Shita and Ushna gunas. It should be generalized for all the Vimshati gunas. So if a disease is caused because of Ushna and Ruksha, you should employ the Shita Dravyas and the Snigdha Dravyas in the Basti. Similarly, if the disease is because of the Khara guna, the opposite guna should be applied in the treatment. So this makes Basti very special because you can identify the Nidana and the plan the Basti according to the disease. And in many contexts, when we look into the Basti, it is explained as Sarvartakari. Sarvartakari stands to doing treatment both apatarpana and tarpana. It is also considered as Sarvartakari. It is capable of curing all the diseases. How it becomes capable of curing all the diseases? As Sushruta clearly tells, it is Nana Vita Dravya Samyogat. It is because of the different permutations and combinations of the drugs what you are going to use in the preparation of the Basti makes it special. So apart from the yogas which have been explained in the classics as an example, for example, Amavata means what strikes to our mind. It is either the Vaitarana Basti or the Kshara Basti. If it is Kafavata Jagridrasi, it is always the Kshira Vaitarana Basti or the Erenda Muladi Niruha Basti. Apart from these generalized preparations, whatever the drugs which have been explained in the each chapter of Chikitsa with special reference to that disease, they can be utilized in formulating the Basti of our own. So Basti gives the physician a wide choice for choosing the medicines. So that makes Basti superior. And the different multifaceted action of Basti is attributed to the dravyas which are used. See, when we count the dravyas which are useful either for Vamana, Virechana or Nasya, you can count them actually. Though it is not a very small number, you can count them. But is it possible to count the number of drugs which can be used in Basti? It's not possible because Charaka explains the dravyas belonging to all the skandhas. The shadrasas, either the drug belongs to Madhura skandha, Amla skandha, Lavana skandha, they can be used. Irrespective of whether the drug is a Parthiva or a Jangama origin or the Stavara origin, the drug can be used. So when it comes to Basti, you have lot of options depending upon the availability and depending upon the disease and the deceased. You can choose and make your own formulations for the treatment. These are some of the references like which are whatever quoted previously are like well known. But why Basti is considered as superior? This is also because it helps in doing the marma paripalana. How to maintain the swasthya? Charaka in the Sutrasthana quotes, Abada Varchanam Nityam, Marmascha Paripalanam. So you should always do the paripalana of the marma, because if the marmas are affected, they can be pranopaghataka. So how will the abhigata to the marma happen? Most people, the physicians think that the marmas get affected mainly by injury, trauma. The trauma is of two types. It could be either the bahya abhigata or it could be because of the abhyantara abhigata. Rather than the bahya abhigata, it is the abhyantara abhigata which affects the marmas and make a person deceased. For example, a prameha or the pakshagata. They are all the examples where the marma is involved because the origin or the adhisthana of the vyadhi is there. So when the vatadi dosha prakopa happens, they are capable of vitiating or troubling the marma. So he tells, Na basti karma sadhyatamaha. So apart from basti, there are no other good treatments available for the basti marma paripalana. Tasmat na basti samam kinchit karma marma paripalanam asti. So no treatments are available to do the marma paripalana, which is better than basti. So he tells basti is the better option when you want to treat the dushta marmas. Then we come across sadaturas, both in Charaka as well as in the Sushruta. We come across the sadaturas. So sadaturas are the people. So in the earlier days, few set of people were recognized, like the Rajasevaka, or the Stri, or this Vanija, or this Shrotriya Brahmana. This four category of the people was recognized as sadaturas because either because of lajja or because of bhaya, they don't pass the natural urges in the proper time. Nowadays, all of us come under the category of sadaturas. This is what we are training our children from the school age, like the natural urges are the calls to be attended only during the intervals, not in between the classes. When we sit for the seminars, when we are taking the classes, it's mainly because of the shyness or because it is not considered as a good social manner. So always they do the Vegatharana. He takes the four reasons why the people become sadaturas. It is Agata Vega Nigraham. So when there is an urge, they suppress it. Then Akala Bhojanam. They don't take food in the proper time. Then Akala Nirharam. Akala Nirharam is nothing but when there is no urge, forcefully they try to eliminate. And Vihara Sevi, it is Akala or an improper Vihara Sevi. Either they sit for long hours. So when you consider the Vanija, because of the Lobha, he'll be sitting in the shop for long hours, for 6 hours, 10 hours they sit. Or Akala Vihara Shrotriya Brahmana, they avoid the timely food and they are always involved in one or the other rituals. Once a priest enters the temple after taking the bath, they are not supposed to use the washroom till they complete their entire procedures and come out. And this is going to be for many hours. So they are Akala Vihara Sevis, and because of these four things, the people become sadaturas. And when they are considered as sadaturas, it's very difficult to treat them because of the continuous Vegadharana. There is like Vegadharana Janya Udavarta leads to Vata Prakopa. Then there is lot of Rukshata in the Sharira. And if you want to plan the Vamana and Virechana, usually they end up with Rakta Chardhana. So the principle is Tan Susnigdhan Shodhayet. Sushruta puts forth the principle that's suitable for Virechana, and you have to take care of the Virechana after a proper Snehana. But doing that proper Snehana itself in Sadaturas becomes difficult because of their Viharas. Because you cannot put them on the Acha Snehapana for the 7 days with the proper Patya Sevana. It is not possible. So that is the reason when a person is suffering or when he is known as a Sadatura, they can be best treated with Basti Chikitsa. So apart from these reasons, like following Patya is very important, like Ashtamaha Doshakara Varcha Bhavas should be avoided throughout the course of Vamana Virechana, Nasya, etc. But that need not be strictly followed when it comes to Basti, because there are a lot of other options in Basti. For example, you have Yuktarata Bastis which can be given when a person is going to travel. So if somebody is coming on an outpatient basis, they are going to use the car or the two-wheeler continuously, they can be planned with Yuktarata Bastis. Our Madhu Tailika Basti does not have any restrictions, which is a very good formulation actually. And there are Yapana Bastis which can be followed without following a strict regimen. So there are a lot of options. Apart from that, Matra Basti is there if a person can't stay for a longer duration in hospital, so which can be administered in outpatient basis. And practically, when we plan Vamana Virechana, what is most difficult is making them to have this Peyadi Krama. That becomes very, very difficult. May not be in Kerala, because most of the people are accustomed to Ganji here. And even in the coastal regions of Karnataka, like when we go to Udupi and Mangalore, the people drink Ganji. But when it comes to North Indians, the internationals, it becomes very difficult to make them follow the Peyadi Krama. Whereas in Basti, that need not be followed, considering the fact that the drugs will not come in direct contact with the Jataragni. So as the drugs don't come in contact, they don't vitiate the Agni. Mandagni is usually not noted unless and until there is problem with the dosage of the snehas, etc. So usually the person is allowed to take a normal food with a reduced quantity. So those are the points for the supremacy of the Basti. So if you look into the age, it is from birth to death. There is no bar with the gender. It can be advised in men and women. When it comes to the physic, yes, it can be administered from lean to obese. And when it comes to dosha, it can be advised in all the three doshas, even with their different permutations and combinations. When it comes to Rusha, yes, different Rasarakta Pradosha Vyadis can be advised to undergo the Basti. And the one more speciality is, it is the only Panchakarma treatment, major Panchakarma treatment, which can be advised in dislocation and fractures. Either as a post-care, it can be advised to improve the strength of the bones. These are some advantages of rectal route drug administration. The one thing is, it is faster in action because it will quickly reach the systemic circulation, and because of its high bioavailability, because the drug will not undergo the digestion process just like any other oral drug, which will undergo a lot of changes because of the GI. So here that can be avoided. A part of the drug or the virya of the drug directly reaches the systemic circulation, and this is especially suitable for the drugs or formulations with unpleasant taste. So even the irritant drugs or the very bitter or the astringent drugs can be used in Basti comfortably. It is useful in children and aged. Children, because if something is unpleasant, they either vomit or they don't take. And in aged, the one reason being, like for the pain management especially, they'll be on some NSAIDs for a longer duration, and one of the most important complication of being on NSAIDs is either the ulcers or the bleeding tendencies. So Basti, as it doesn't come in contact with the GI, it can be very safely, for a long term, it can be administered in the aged people for different purpose. And it is also considered as a best treatment of choice in vomiting and unconsciousness, because the rectal rehydration is easy compared to oral rehydration in vomiting, because the people develop nausea when you try to introduce the solutions orally, whereas rectally it can be rehydrated. This idea became very popular during the World War I, where the rectal rehydrations were used. The one thing being, it does not require an expertness to administer the medicine. Second thing, the chances of infection of using the local water are very low when it is administered rectally. So it was very popular, and even in the villages, in some folklore traditions, they practice the rectal rehydrations actually. But the concept dropped once the IV infusions and the feeding tubes become popular. These are some disadvantages of using the rectal route. It is, the one important thing is, it is an underused route. Rectal route is an underused route because of the intimacy of the site. It is not socially accepted. People don't like it. The society don't like taking the enema. Then it is disliked by some patients, especially the females. They don't like to take the Bastis. And not suitable immediately after the anal or the rectal surgeries. Then the one side effect being irritation and inflammation of the rectal mucosa can happen. So those are the disadvantages. This is the classification of Basti. I don't think I have to go in detail with that. You know, like various classifications are available. Apart from this, many more classifications are there. So whatever I could combine and present in a slide, I have taken here. This is the classification of the enema. I would like to explain this briefly. Many classifications or enema are available in the modern science, but to understand the basic classification of the enema, they are usually grouped into evacuant enemas and the retained enemas. We don't have a concept of retained enemas. Though nowadays some physicians are trying the takra bastis and the pischa basti as a retained enema with the drip method. They are trying it now, but there is no concept. When you look into the classics, there is no concept of retained enema in Ayurveda. The evacuant enemas are classified into simple evacuant, medicated evacuant, and the cold enemas. Simple evacuant means a simple normal saline solution introduced as an enema, and it will eliminate the feces with the gas. That is the simple evacuant enema. When it comes to medicated evacuant enema, there are oil enemas which are retained up to 1 hour. They soften the feces and then they bring the feces out. So they are usually indicated in hard stools or severely constipation is one indication. Then purgative enema, it is an enema solution with purgative drug in it. It irritates the mucus. It increases the peristalsis and then evacuates the feces. So then it promotes the defecation reflex. Astringent enema is nothing but the enema prepared with the astringent drugs, and it is used as a treatment of choice in ulcerative colitis and in dysentery or the diarrhea. What happens here? Because of the astringent quality of the enema, it contracts the blood vessels and it causes a soothing effect over the mucous membrane and helps to reduce the bowel movements in the ulcerative colitis and the diarrhea. Then there is also antihelminthic enema. We have Krimihara bastis, which is one of the Prasthita Yogika basti, and similar to this there is a concept of antihelminthic enema. So before antihelminthic enema, usually one evacuant enema should be administered, and afterwards the enema with the antihelminthic drug will be administered, which will act on the worms. And the fifth one among the evacuant enema is the carminative enema. So this helps to relieve the pain and the gaseous distension of the abdomen. So the main reason is the abdominal pain, or when there is a bloating of the abdomen, such enemas are given. Among the evacuant enema, the last one is cold enema. As the name suggests, the ice cold water is used for the enema here, and it is indicated in hyperpyrexia and when a person is suffering from heat stroke. So it reduces the temperature. So better than the oral drugs, the rectally administered ice water will help to reduce the temperature of the body. When it comes to retained enema, see, Niruha bastis are not indicated in Mada and Murcha. Actually, the stimulant enema is indicated in a person who is unconscious to stimulate. So they are called as, so when a person is not responding, these enemas are administered. Then nutrient enemas are administered to someone who is debilitated, who is not fit for the oral rehydration, or who is not able to take, because once there is a dehydration, the nausea develops. So rehydrating a person with the oral solution is not easy. But if a person is not even suitable for the IV, can you just tell one condition where a person is contraindicated for the IV? To rehydrate? Hemophilia. It's where you cannot rehydrate with the IV infusions. Then giving a nutrient enema is a good choice. Where a pre-digested food mixed with the solution is given for the nutrient enema. Otherwise, you can use any nutrient solutions for the enema. Emollient enema is nothing but a bland enema. It's a bland enema which is given to soothe the rectal mucosa. It is also used in ulcerative colitis. Then sedative enema is nothing but enema with a sleep-inducing drug, which helps to promote the sleep. That is sedative enema. Anesthetic enema, similar to sedative. When an anesthetic agent is used along with the enema, it helps to bring the anesthetic effect. So those are the classifications, just like how we can correlate our bastis to the enemas. So when it comes to the treatment, so what makes bastis so special as a Sampurna or Ardha Chikitsa? Charaka explains, it is Samiksha, Dosha Aushadha Desha Kala, Satmya, Adi Vayobalani, Bastim prayuktam niyatam gunaya sat sarvakarmani cha siddhimante. So these 9 factors are explained as very, very important. And what should be done? The samiksha should be done. And what is the meaning of samiksha generally? What is samiksha? Assessment. Samiksha is jnanapurvaka pariksha. Jnanapurvaka pariksha means it is not the examination, it is not the assessment. The examination anybody can do, whether he has the knowledge or doesn't has the knowledge is a different issue. Examination, even a second year BAMS scholar, student will do. Samiksha is when you have a complete knowledge about the doshas, their sthanas, their vriddhi and dikshaya, the amshamsha kalpanas, their samsarga and the sannipata. You also have the knowledge on basti, the various bastis available for the treatment, and you do a pariksha of the dosha, desha, etc. Then it becomes the samiksha. So these are the samiksha bhavas, and among them what is very much essential for the success of the treatment is aushadha. So these are the ingredients of the basti. Almost all the niruha bastis will have the ingredients like makshikam, lavanam, sneham, kalkam, kautam, iti kramat, and followed by avapa. So let's look into the qualities of each dravyas and how to mix them. Makshika, as you know, it is madhura kashaya rasa, it is laghuruksha in guna, its virya is shita, and karma is lekhana, chedana, sandhana and sukshma. The most important quality of the madhu and saindhava are they are sukshma, and madhu has the quality of yogavahi. And this is the matra of Makshitaka according to different authors. So well known and the followed matra is according to Chakrapani. For Vata Vyadis it is 1.5 prasrita. For Pitta Vyadis it is 2 prasrita. And Kafacha Vyadis it is 3 prasrita. And this is the lavana. The rasa is lavana and madhura. Madhura is the anurasa for saindhava. And it is anushna shita or kinchit ushna. When it comes to virya, its gunas are snigdha, tikshna, laghu and sukshma. Because the madhu and the lavana are sukshma in nature, they help for the absorption. Actually, that is the reason lavana should also be added when you are administering the matra basti or the sneha basti. It should be a part of anvasana basti actually. And in karmas includes the deepana, vishandana, vatagna, marga vishodhana, etc. Coming to the matra of lavana, according to Chakrapani it is 1 karsha, and according to Kashyapa it is half karsha. The quantity of lavana or its proportion is very, very important. See, in Dwadasha Prasaratika Basti there is around 12 grams of lavana. It's 1 karsha of lavana, and the normal saline has 0.9%. We are almost adding 1% of the lavana, which facilitates the absorption of the basti dravya, and it's a very good solution. Like, it won't cause the dehydration easily. And the importance of sneha, because we are going to administer the drug to the vatasthana, because through the guda we are trying to administer the medicine to the pakvashya, and our action is expected in the pakvashya. So as it is a vatasthana, lubrication is very, very important. It also, according to many authors, it helps to attain the eki bhava of the basti dravya. Means the homogeneity of the basti dravya is attained because of the sneha is the opinion. There are various opinions. Some agree or believe that it is because of the sneha, and some believe it is because of the kalka, which helps to attain the eki bhava. So the homogeneity of the mixture is attained because of the sneha. This is the sneha matra according to various authors. And generally followed is again like Chakrapani, which is opposite to the quantity of madhu used in the basti preparations. For vata, pitta and kapha, it must be 3 prasrita, 2 prasrita and 1.5 prasrita respectively. Kashyapa tells it should be 2 prasrita, but depending upon the doshas, the quantity of madhu and sneha are always fixed. Coming to the kalka, how to understand kalka? The one common mistake what we do is in practice is, in classics they have told the kalka pramana as 1 prasrita. So what we do is, when we are calculating the basti matra, we randomly write 20 grams of churna, 30 grams of churna, 40 grams of churna. It is churna. And what is important when it comes to quantity? It is kalka. So you must always have an awareness what would be the weight after you mix it either with the kashaya or with the warm water. Without that, that's why many bastis become too sandra. If you follow the classical matra of the basti dravya preparation, it becomes very, very ghana actually. It becomes thick in consistency, which cannot be administered using a edema can. So it is the quantity of the kalka, not the churna, basically. So it helps to add thickness to the basti dravya, and the potency of the basti dravya depends on the kalkas added, and it helps to disintegrate the mala when it is administered. And in case where the kalka dravya is not mentioned, it's always the yavanyadi kalka. There's one more misconception. It is always read as puta yavanyadi kalka. No, it is yavanyadi kalka. Putam means you add, you pour, you throw. That is putam. See, mistake committed by one author will be carried for generations. So the kalka should be known as yavanyadi kalka. Puta means you are going to add it, you are going to throw it to the basti dravya. And according to Sushruta heaters, the Madanaphala kalka can be used, especially when you are formulating the Shodhana bastis. The Shodhana bastis, what is Shodhana basti? Shodhana basti is something which is formulated with the Shodhana dravya. Actually, without a Shodhana dravya, without having any of the Vamana or Virechana dravya, the basti can never be a Shodhana. So Madanaphala is one of the safe drug to be used in Shodhana bastis, and he tells the Madanaphala kalka can be used. So kalka matra, generally it is considered as one prasrita. As I said, it is kalka matra, not the churna matra. So coming to the kvata, it helps to add volume to the basti, and you can choose the different drugs based on the dosha, etc. And it accelerates the absorption. This is the preparation of the Balaguducha, the Kvata, told by Charaka in Siddhisthana, 3rd chapter. He quotes it as a standard example for the preparation of the Basti Dravya. And here, what we have to remember is, say, market available samples to the classics, there is so much of difference. Usually, what is the quantity of the Kvata Churna present in the market available, any of the Bastis? What is the quantity? In grams. 100 to maximum of 150 grams. You know, here Charaka tells a principle, it should be Kvataha Kvatya Samaha. Kvatya Samaha means if you want to prepare 300 ml of kashaya, you are supposed to add 300 grams of Kvata Churna. If you want to prepare 400 ml of kashaya, you should approximately add 400 grams of Kvata Churna. Then only the basti should be prepared. So it is 1 part of the dravya added with 16 parts of jala, boiled and reduced to 1/4. So if you want to prepare the 400 grams, you have to calculate 400 ml of the kashaya. If you want to prepare, you should take 400 grams of the Kvata Churna, whether it's Erandamula, the Dashamula, the 400 grams you have to take and mix it with the 16 parts of water and boil and reduce it to 400 ml. If you are doing the Kshiravashesha, you can add Kshira while preparing the kashaya, or the best thing is prepare the kashaya, add it with the Kshira, reduce it to Kshiravashesha. So this is the principle in preparation, Kvataha Kvatya Samaha. So this gives a lot of thickness actually. So you can see the finally prepared Basti Dravya, it is not too liquid. Isn't it? You can find out its thickness. It is something similar to, very easy to tell, nearly to Takradhara. The final prepared product should look like a Takradhara preparation in thickness actually. So that means that even in Takradhara you are not supposed to use a too thin liquid. Got it? Yes, this is Avapa. All the acharyas have highlighted the preparation of Basti Dravya is incomplete if you don't add an Avapa to this. So depending upon the dosha or depending upon the vyadhi, you should always add an Avapa. So it helps in throwing the additional ingredients, the required ingredients to the Basti Dravya, and it is believed to improve the efficacy of Basti Dravya. The best known Avapas for the doshas are for Vata, it is Mamsarasa, for Pitta, it is Kshira, and for Kapha, it is Gomutra. These are the best known Avapas. For Pitta, in some cases we add Ikshurasa. In some cases we can add, like a person having too much of Dhaha, after the Kshira Basti preparation we can add Kshira. So like that you can use different drugs for the Avapa, but Avapa is must. And if you are adding Mamsarasa, the quantity is around 2 prasrita, and if you are adding Gomutra, the quantity of Avapa is around 1 prasrita. So this is like the proportion of ingredients for Pravara Madhyama and Avara Matras. This is according to Sharangadhara. Nowadays we don't follow either the Charakas or the Sushrutas Matras in practice. We follow the Avara Matra of Sharangadhara, which is around 576 ml. Basically. So in 576 ml, if you want to add Saindhava, how much Saindhava will we add? It's around, no sir, 12 grams is told for Dwadasha Prasatika Basti. So it is around 5 to 6 grams. So it is a simple method to calculate is whatever the final product of Basti Dravya is there. If it is 400 ml, 4 grams of Saindhava. If it is 600 ml, 6 grams of Saindhava. Easy calculation. And when it comes to the quantity of Madhu and Sneha, simple logic. For example, if you are taking around 300 ml of Kashaya, approximately the Madhu and Sneha should contribute around 350 ml. 350 ml. That is the standard proportion. It is not exactly equal. It is a little lesser than the Kashaya quantity. See, look into the classical preparation. Makshika and Sneha togetherly, like it is more than the Kwata Dravya. See the final preparation. Whatever I told is this little lesser, which is advisable to administer in enema can, because this preparation becomes thick and we are not going to add the 48 grams of Kalka. We'll be adding around 30 grams of Kalka to the 576 ml so that it is ideal to administer in the pot method. Is that fine? Yes. So this is a general matra. If you look into the percentage of the Madhu and the Sneha, this is the matra which is around 40% of the Basti is with the Madhu and Sneha. And Kwata is 33 and Avapa is 16. So Avapa and the Kashaya will make around 40% of the Basti Dravya and the Madhu and Sneha will make around 40% of the Basti Dravya. This is the concept. So whenever you prepare Basti, because Basti Dravya is told to have Ekadasha doshas, among them Atidrava, or Ati Sandra, or Ati Tikshna, or Ruksha, then Ati Shita, Ati Ushna, so many have been told. So Ati Ruksha, because if you don't add a sufficient quantity of Sneha. Ati Ushna, if you add more quantity of either the Gomutra or the Saindhava Lavana. It becomes Ati Snigdha if you add excess of Sneha. It becomes Ati Drava if the Basti Dravya is not reduced properly. Got it? So lot of doshas will come up if this preparation is not taken care of. Then the expected results may not be achieved with the Basti. So this is the general proportion. This is the order of busting of Basti. I need not highlight this. All the order is the Makshikam, Lavanam, Sneham, Kalkam, Kwatam, Iti Kramat. So one after the other we have to take the ingredients in the Kalva and we have to start mixing. We'll see the different types of mixing. This is the mixing, the first one. They are doing the maceration or the trituration with the Pani Tala. This is told by Sushruta. Sushruta explains, you can look into the relevant shloka there. Datvadav Saindhavasya Aksham Madhunascha Prasruta Dvayam. He tells 1 aksha of the Saindhava should be taken and 2 prasruta of honey should be taken. Patre, it should be taken in a patra. Talena matniyat, he tells. Talena is nothing but the pani tala. So you should use your palm to triturate this. Then Tadvat sneham shanaihi shanaihi. Then slowly you should, once you attain the homogeneity of the mixture, then the sneha should be added slowly. He tells shanaihi shanaihi. Not at a time you pour the 100 or 200 ml of the sneha. Slowly you have to add it. Then samyak samutita dadyat. And after you ascertain that it has been properly mixed, you add the kalka. And afterwards, he tells Gambire Bhajane Anya. So then you have to transfer this. So once you have mixed Makshika, Lavana, Sneha and Kalka using the Panitala, you have to transfer the entire thing to the another Patra, which is Gambira or the Drida. Then you have to add Kashaya to that and you have to churn using a churning stick. This is the procedure told by Sushruta. And after the preparation, it's always like once the Basti Dravya is properly prepared, the stability period is for 3 to 6 hours definitely. So if you want to administer even at 11 o'clock, the Basti Dravya can be prepared 7 o'clock in the morning in the theatre. There is no problem. But take care that it will not get infected with either somebody puts their hand or uses some wrong vessels and all those things. But when you want to administer it, he tells Vastraputam. Just Vastraputam means you have to sieve that. And Ushnaba Kumbi Bashpena, you have to keep it in a hot water bath. Then you can administer the Basti. So these are the Suyojita Niruha Basti Lakshanas. How will the properly mixed Niruha Basti Dravya look? Aushadam Nadhavate, this is very important. You see, all of us are attached to the teaching institutions where the therapists or the UGs prepare the Basti Dravya. You just ask them to keep few samples of the Basti Dravya prepared in the morning, and when you go at 9 or 9:30, you just check how the Basti Dravya looks. If you pour it on a palm and see, it should not run. It should not run. It should not be too thin. Neither it should become like a lepa. It should not become like an application. It should not produce a simanta. It should not produce the lines when you pour it on your palm. It should not be na sandra. It should not be tanu. And it should always have the eki bhava. Means it should look like a homogeneous liquid or a suspension. So these are the qualities of Suyojita Niruha Basti Lakshanas according to various authors like Chakradatta, Vangasena and Sushruta. So this is the final consistency of the Basti Dravya prepared according to Charaka Siddhisthana 3rd chapter, taking the proportions of the Mamsa and the Basti Dravyas which have been explained, like Kvataha, Kwatya Samaha. This is how the finally prepared Basti Dravya looks actually. And this cannot be administered using the enema can. That is the disadvantage. And I heard in Kollam they are using the Putaka for the administration of the Basti. Always encourageable to go for the classical method of preparation of the Basti Dravya. Yes, to understand what sort of a liquid it is, it's an emulsion. And all of you, I hope you understand what is an emulsion. So emulsion is nothing but a mixture of 2 or more liquids which are normally immiscible. So normally they don't mix easily, or they don't mix, or when for example if a milk is mixed with the oil, they form 2 separate layers. They don't mix. They are considered as immiscible. It's an immiscible mixture. So when they are mixed properly, it is considered as an emulsion. The best example we can see is milk, where the fat and other substances are mixed with the water media. So when you look into the emulsions, there are various types of emulsions, but the 2 simple basic emulsions are oil in water and water in oil. Apart from this, the complicated emulsions are there, like oil in water in oil, then water in oil in. So when we think of the creams or the cosmetics, a lot of development is there with respect to the emulsions. So basic emulsions are either oil is dispersed in the water medium or the water is dispersed in the oil medium. These are the 2 basic emulsion varieties. And Basti is the oil in water emulsion. So what is required to prepare an emulsion? It is the emulsifier or the surfactant which is required to prepare an emulsion. So their nature is amphiphilic. So amphiphilic means they'll have one polar end and one non-polar end. Just imagine a particle has one polar and one non-polar. The polar end will have an affinity for the water and the non-polar end will have an affinity to the oil. So when it mixes, so one end of that drug will be attached to water molecule and the another end of that will be attached to oil molecule. So for example, honey is a natural emulsifier. So when honey is mixed with the sneha and the kashaya, what happens? One end will be attached to the sneha, the oil, whatever you are using in the basti. Other end is attached to the water particles of the kalka or the kvata. So it makes the mixture homogeneous. So these are the tests of emulsions you can try to understand which form of the emulsion it is. Dilution test, I'll show it. This is the dilution test for the enema. dravya. So we have two test tubes where you can see that the Ruhabasti dravya is there. In the second slide, second part you can see the one test tube is added with the oil, and in the second test tube we have added the water. And in the third you can see here the oil totally separates from the Niruhabasti dravya, whereas here the homogeneity is achieved. So this shows that this is an oil in water, so oil cannot be mixed easily with the end product of this. So it shows that it is an oil in water suspension. So water is the dispersing media here, not the oil. If it is a water in oil sort of the enema, oil should get mixed. So you cannot mix it. This is called as a dilution test. Then we also have a dye solubility test. Simple test where a water soluble dye is taken. So you can see in the first picture, when a water soluble dye is added to the Niruhabasti dravya, what happens, because these are all the water molecules, these are the oil particles, are the oil molecules, they will not take up the dye. Only the water will take up a dye. It is a soluble, it is a water soluble dye. So you can see the continuous phase is water, and wherever there is white portions, it is the oil molecule. If the same test is done for the oil in water, the water in oil emulsion, it will be like this, because here the water is taking up the dye, which is small, whereas the dispersing media is oil. So Niruhabastis will show the result like that, which is in oil in water emulsion. There is one more test called conductivity test, based on a principle that water is a good conductor of electricity. When you connect the electrodes, the bulb glows when you check it with the Niruhabasti dravya. So these are the tests to confirm the emulsion. So just for interest, we just tried the different methods of mixing the Basti dravya. So this is with the mixer method and checked for the stability. So what is the stability of the Basti dravya? It is the quality of the Basti dravya to resist any changes in the dravya for few hours. It considered as a stability. So it will have the stability for a varying period of 3 to 48 hours depending upon how well you have mixed the Basti dravya. For example, see, this is the stability period for the Basti dravya which was mixed in a mixer. So what we have done is not one after the other. We have taken all the ingredients of the Niruhabasti at a time in a jar, and we have mixed using a blender. And it was prepared at it was prepared at 12:30, and you can see the particles started separated by 2 p.m. So by 1.5 hours they started separating, and at 3:30 you can see the oil and the water portion is totally separated. You can see the oil in the end of the test tube, bottom of the test tube you can see the oil. It shows that the Basti mixing cannot be done in a mixer effectively. This is like the ingredients were put one after the other. We tried putting first the makshika with the saindhava, then after churning it for 2-3 minutes we have added the sneha. Like that, one after the other the ingredients were put and they were churned, and again even it showed that the particles started separating by 2 p.m. and by 3:30 the ingredients got separated. You can see some oil portion in the top of the test tube, whereas some oil portions are the kalka getting separated in the bottom of the test tube. So this also shows that the stability period is not good, where even if you are mixing it one after the other. Similar things happened when we used the other methods, not only this juice maker. So we tried different churners, but they were not good. This is what happened to the Basti dravya prepared with the Panitala. So we prepared it with the Panitala, and after the preparation with the kalka, we transferred it to the vessel, and then we churned the kashaya. By adding the kashaya, we churned with churning stick. But even then, it did not show the good stability. The particles got separated by 3:30, but this I still doubt, because the pressure applied over the medicine using the kalva, it is difficult to standardize. We don't know, like this, it depends upon the strength of the individual, how continuously for 1 to 1.5 hours they can keep mixing, because to mix the saindava and honey they have taken around half an hour, then to add it with the sneha and to mix again half an hour they have taken. With the kalka they have taken around 15 to 20 minutes. So continuously they have mixed for 1.5 hours. You cannot really rely upon the pressure applied by a person while continuously they are doing that, because you start getting the pain in the joint, right? It's difficult to do, but they got separated by 3:30. This showed a good stability, though it is not very logical or cannot be supported with the classical view. All the dravyas were put together in a kalva, actually, like Makshika, Sneha, Saindava, everything was added. Then they have done it with the kalva yantra, and basti like the final product was prepared by 12:30, and you can see at 4:30 it is still stable. Next day morning 12:30 it was prepared on the previous day, and next day morning the slight separation has started. It was stable, means even if the ingredients are not added one after the other, if all of them are added together and if they are mixed also, it has shown a good stability. This is the classical method of the preparation. You can understand the thickness of the basti dravya even by looking into the photograph. It is so thick, and ingredients were put one after the other in the kalva yantra and they were mixed in a classical method, and you can see even after the 48 hours it was stable. This is the Suyojita Niruha Basti Dravya assessment. It doesn't do the lepa, but it is thick. It is thick. This is like with the principle of like taking for 400 ml of kashaya, we have taken 400 grams of the kota churna. The kalka in the set proportions we have taken. It is really thick. So we tried with one more method actually, because nowadays a lot of speculations are going on related to the quality standards of honey. Recently, like maybe before 6 to 8 months, most of you are aware of, you could have read in the newspapers saying that the major brands in India, they failed to pass through the NMR test. And there were a lot of speculations that it is an imported sugar syrup. It is an imported sugar syrup from China, and they have made it, so cleverly, it will pass through all the tests. The general honey standard test it will pass, but it will fail only in NMR. So, which made us think whether there is any alternate to prepare the basti dravya, because why honey is preferred? As we all know, it is kafahara, and it has very good properties like yogavahi, sukshma, laghu, all those things. But if at all we are going to use a sugar syrup in the name of honey, what is the outcome of that? Like, what is the medicinal property of the honey? And nowadays, even if you get a honey, it's all the cultivated from the honeybee. It is a cultivated honeybee collected honey. Usually they are kept in rubber plantations, actually. So there is no variety of the food or the nectar source for the honey. That's why most of the honey, like when you start triturating it, it becomes white in color. It becomes white in color, and sometimes you can even note the gudapaka. Because they'll use the gudapaka to do the adulteration for the honey. You can see at the end of the bottle, if you have taken a 1 kilo of the honey, you can see at the end, you can literally see the gudapaka actually. So if that is the case, what is the purpose or point in using that in the basti dravya? So keeping that in mind, we started searching for a best emulsifier. It is the egg yolk which is considered as the best emulsifier in the food industry. And there is no contraindication for using the egg in our classics, because it's a part of Vrishabasti. Egg kukutanda is a part of Vrishabasti in the preparations. The only problem is if a person is like an orthodox, strict vegetarian, they may not admit this. So that satmeta is very, very important. That's why the many basti preparations developed even with the gudapaka, because the Jains don't take honey. They don't use honey in their food or any part. So even the bastis developed during the Jainism with gudapaka, the Vaitarana bastis and all. So, but egg yolk is the best emulsifier, I'll tell you. Like, the time taken even to do the trituration can be minimized when you use the egg. And if you look into the qualities of the egg, it is Nati Snigdha, it is Vrishya, it undergoes the Swadupaka, it is Vatagna, and it is Shukra. And so these are the qualities. So we prepared the Erentamula Basti using the egg yolk, and we even checked for its stability period. So you can check like the stable for more than 48 hours. The Basti Dravya was stable for more than 48 hours when it was prepared with the egg yolk. You can find a couple of articles in the internet related to the method of standardization of the basti. I could find one article where they have used gum acacia as an emulsifier. But kukutanda is better than gum acacia, because gum acacia doesn't have any medicinal property. And we try to check the pH of the basti dravyas. What could be the pH of the basti dravyas? It's interesting to know, right, whether it's acidic or alkaline. So Whenever the bastis are prepared with the kashayas or with the milk, they are acidic in nature because of the presence of lactic acid in the milk. So whenever you add an avapa to the basti dravya, or when the kshira kashayas are prepared, the pH is somewhere between 5 to 6. 5 to 6. But if you're using the gomutra or yavakshara or sarjikshara or any other sort of the kshara dravyas, it is not very alkaline, I'll tell you. Not very alkaline. We had just taken a sample of 50 ml of the prepared Erindamoola Kashaya Basti, and we tried adding the Yavakshara. Checked after adding each gram of the kshara what is the pH of that basti dravya. You know, to become slightly to the normal, to the acidic range to 7, it took 8 grams of Yavakshara. 50 ml of Erindamoola Kashaya has taken 8 grams of Yavakshara to show the acidic nature. So this needs to be really like researched, because in the classics they have told like 1 kudava of gomutra, 1 prasrita of gomutra, or when the Vushakadi Gana dravyas are used, it is used in pala. But we are so scared. We never use it as a kalka dravya. We use it as a prakshepaka dravya. At the end product, we will start counting in pinches and we will add 2 pinch, 3 pinch of Yavakshara, Vushakadi Gana. But pH won't change. They have told to make it a purpose of alkaline. Whatever the preparation we are doing is not going to serve the purpose. That's what I understood, but still hesitant because it is not there in practice since decades. It's not, if I had seen any one of my teacher practiced the Lekhana Basti with 1 pala of whatever the Ushakadi Gana, I would also gain the confidence to do it. Once I'm not doing, my students are not confident. That's what is happening. So lack of research, because we're always worried what will happen to the mucosa, the rectal mucosa, whether the irritation will happen or whether bleeding tendencies are noted. That's why the ksharas are never added in more quantity. Maximum is in Vaitarana Basti only when we are using gomutra. Apart from that, the other ksharas are not added actually. So most probably it is the time. Probably we can even start with the animal experimentation and come to a conclusion whether it is really shows any side effects when we use the larger quantities of the kshara in the basti. This is the preparation of Vaitarana Basti. I really felt it is special because there is no emulsifier here. Because to make an oil in water emulsion, what is required is an emulsifying agent, either a honey or the egg yolk. When we don't use them, this is prepared with a chincha kalka, right? Chincha kalka is used as a kalka dravya and gudapaka is used instead of honey. So how will it look? So soon after the preparation, it is stable. But after 3 hours, see, it started separating after 1 hour, and by the end of 3 hours, you can see the 2 different liquids here. So it gets totally separated. So that shows without an emulsifier, the basti dravya is not stable. See, such bastis cannot be kept. Soon after the preparation, you have to use them. The other bastis can be kept for 3 to 4 hours, and again they can be like warmed by keeping it in the hot water bath, and they can be used. But the bastis where honey is not there should be used immediately. So whenever you use the gudapaka, immediately after the preparation you should use those bastis. Otherwise the absorption will not happen. So this is something like how long the basti mixing should be done. It will take around 1.5 to 2 hours if you are doing a proper basti mixing, because each stage will take around 20 to 30 minutes. We tried preparing few slides at different intervals when we are mixing the basti dravyas with the madhu and saindhava followed by sneha, kalka, etc. How will it look? We tried analyzing the particle size just like with the microscope, and the how will it spread actually, whether there is uniform spreading of the dravyas will happen or not. So this is just after the 2 minutes after we have added the madhu and saindhava, the first picture. You can see the particle size, they are quite big, not uniformly spread. They have started spreading after the 5 minutes actually, and towards the end you can make out very small after 25 minutes actually. From 20 to 25 minutes you can see more uniformly spread and more particles are having the small size actually. This is very important to note, and this is like how initially when you add the sneha to the madhu and saindhava look like. And once you add the kalka, so kalka dravya, the 5 minute to 30 minute, you can see the difference, how differently it will look. I heard even the organizers have prepared 10 or 20 slides for the microscopic observation. 10 slides they have prepared. So this is how like it spreads. And this is with the kashaya. The end product, the finally prepared product of the Basti Dravya will look like this when you check it under the microscope. And we tried doing the same thing when it was done with the egg yolk. See, it being a very good emulsifier, you can see the changes by 10 minutes, how uniformly it has spread, how uniformly it binds the molecules. And by the end of this makes this Basti Dravya more stable. So if you compare it with the previous ones, see here you can see, right, the particles are so small, so uniformly they are like distributed. It is not noted even with the Madhu and Saindhava. See here it is not that uniform. And even the particle size is comparatively bigger when we triturate it with the honey. But with the egg yolk, it is more uniform. Particle size reduced. So that makes it a best emulsifier. This is when we add to the combination of Makshika and Saindhava, when we added the Sneha to that. That's how it looks initially, like the few particles are being like dissolved in like a Sneha it looks. Later on like the spreading starts. This is how it will look when you add the Kalka to that and mix. And this is the final product of the Basti Dravya after mixing it with the Kashaya. So each step we have taken around 30 minutes. 30 minutes we have taken. And many authors have opined that when you start mixing the Makshika and Saindhava, you should continue till the sticky sound disappears. So we prepared various bastis for a couple of days continuously, and we noticed that depending upon the amount of pressure applied and how strongly you are doing it, it would take around 20 to 30 minutes for the sticky note sound to disappear. Then you again add with Sneha Dravya, it will take 20 to 30 minutes in a similar way for the homogeneous mixture. And without the homogeneity of the mixture, the Basti Dravya is not stable. So the homogeneity of the finally prepared product will depend upon the first two steps, how you mix it with the honey and how well you are going to mix it with the Sneha. So the end product depends on these first two stages, and it will take around 50 to 60 minutes if you are properly going to mix. So you can find few articles in the internet related to Bhavana Samskara and the particle size distribution. We tried, like, because the Basti takes so much of time for mixing, can it be stored in a dehydrated form? So what we have done is, we have taken the Basti prepared with the honey as well as with the egg yolk and kept it in a dry in the ring water bath, and it took 15 hours to dehydrate. It has taken 15 hours, so at the end it has become a dry like this. And this after 2 months. We have stored it for 2 months. The lacking thing is we have not gone for any antimicrobial activity or anything. But afterwards we exactly counted like what was the proportion of the Basti Dravya kept, and after the dehydration what is the final weight of it. So Erenda Moola, the Basti Dravya was around 36 grams. It was mixed with the 64 grams of hot water and triturated. You can see it looks like exactly a fresh prepared Basti Dravya actually. The similar thing was even done with the egg yolk. Like 40 grams was mixed with the 75 grams of the water, and it was mixed. And finally, those products were checked for the stability period. And they were stable almost for 24 hours. After 36 hours with the honey, the sedimentation started. Actually, you can note down the first one was with the honey. After 36 hours, it began, and after 48 hours, you can see the proper sedimentation and the separation of the dravyas. But that which prepared with the egg yolk was stable even at the end of 48 hours. So no separation has started. This is the mechanical preparation of the Basti instrument, which is available in, it is developed by STM Hassan, where this can be utilized for the mixing of the Basti Dravya. I don't know the efficacy. Courtesy by STM College of Ayurveda, Hassan. Yes, you might have come across various varieties of Bastis like Kshara, Vaitarana, Churna Basti, etc. Have you ever heard of Dhuma Basti? Dhuma Basti? Definitely it's not an Ayurvedic reference, I'll tell you. Dhuma Basti, it is the tobacco smoke enema, which was used for the drowning who are nearly dead for resuscitation. Actually, as soon as the tobacco came into the popularity, the people also started using it as a medicine. At that time, it was believed that it is very good to treat the cold, cough, asthma, etc. So the people who were drowned, they were used for a resuscitation. This was in practice for many years. Not one or two, for many decades it was in practice. And later, one scientist described that it is not good for the respiratory system. It could be poisonous if you are using it like this. Then the practice of this declined. So it is known as a tobacco smoke enema. We don't have any smoke enemas in Ayurveda, like no dhuma bastis. But this is one very rare thing. If you put the smoke enema, you can open a lot of articles, and the wiki gives plenty of information related to the tobacco smoke enema. So this procedure was used to treat gut pain, and attempts were often made to resuscitate the victims of near drowning. There was a project which was sponsored by a queen to work for this tobacco smoke enema. I have taken few points for the discussions, which we really think of when we are scheduling the bastis. So what basti pattern should be followed? It definitely depends upon the dosha, whether it's the vata dominancy, pitta dominancy, or the kapha dominancy, or it is the samsrishta or sannipata. It also depends upon the agni bala of the person, whether a person has the pravara, madhyama, or avaragni bala. So the basic principle behind the basti schedule is always with the sneha bastim niruham va na ekamevati shilayit. Either the niruha or anuvasana should not be used alone in excess. This is the principle. And what happens if the sneha bastis are given continuously? He tells the utklesha of the doshas will happen, and the agni will go down, and with the niruha there is always a risk for the provocation of vata. That's the reason tasman nirudaha samsnehyo. This is the principle. So after the niruha, give the anuvasana basti, niruhascha anuvasitaha. After the anuvasana, administer the niruha bastis. Only when the basti is combined with the effect of the snehana and shodhana by means of niruha and snehana by means of the sneha bastis, basti karma is considered as tridoshanut. It is capable of Tridoshahara only when it's given in a combination. So these are the different basti patterns available in the classics. We are well aware that there is yoga basti pattern, kala basti pattern, and karma basti pattern. For the 8 or 15 or 16 bastis, and karma basti taking 30 bastis. There is also one more pattern explained by Kashyapa as Chaturbhadra Kalpa Basti. It is like administration of 4 Anuvasana Bastis in the beginning, followed by 4 Niruha Bastis continuously, and again it will end with 4 Anuvasanas at the end. So there are 16 Bastis here, which will have the 4 Anuvasana, 4 Niruha, and 4 Anuvasana at the end. So this is a description of the karma, kala, and yoga basti according to Charaka, and this is according to Vagbhata. The one difference being in kala basti there are 15 bastis according to Vagbhata, and there are 16 bastis according to Chakrapani. So this is the schedule. According to Kashyapa, no doubt there are 8, 16 and 30 bastis, but he enumerates it in a different way. He tells Anvasanaha Chaturvimshatihi Niruhaha Shatcha Karmani. So this is the pattern of Karma Basti, where he explains there are 24 Anuvasana Bastis and 6 Niruha Bastis in Karma Basti. According to Charaka, there are 12 Niruha Bastis and 18 Anuvasana Bastis, but here there are 24 Anuvasana Bastis with 6 Niruha Bastis. In case of Kala Basti, there are Dwadasha Anuvasanaha. There are 12 Anuvasana Bastis and there are 3 Niruha Bastis. According to Charaka, there are 6 Niruha Bastis in Kala Basti. In Yoga Basti, again, he tells there are 5 Anuvasana Bastis and 3 Niruha Bastis. So 24 plus 6 will become around 20. So where are other 10 bastis? He tells Panchadav Karmani Snehaha. So in the beginning you have to give the 5 Sneha bastis in karma and 4 at the end. And in Kala basti you have to give 3 and 3. In the beginning there should be 3 bastis and at the end there should be 3 bastis. And Yoga basti, in the beginning there should be 1 basti and in the end there should be 2 Anuvasana bastis. So this is the schedule pattern of the Karma Kala and Yoga basti according to Charaka, Vagbhata and Kashyapa. So you can see the difference in Kashyapas. In Kashyapa Karma Basti there are 5 Anuvasana Bastis in the beginning itself, followed by 1 Niruha alternated with 3 Anuvasana. So there is 1 Niruha followed by 3 Anuvasana. Again there is 1 Niruha followed by 3 Anuvasana. Like that, the 6 Niruhas which are followed by 3 Anuvasana Bastis, and at the end there are 4 Anuvasana Bastis. Altogether it will make 30 Bastis. This is the schedule of Karma Basti according to Kashyapa. And according to him, the Kalabasti pattern is 3 Anuvasana in the beginning, followed by 1 Niruha, altered with 3 Anuvasanas later. Similar pattern, there are 3 Niruha Bastis, followed by 3 Anuvasana Bastis, and at the end it ends with 3 Anuvasana Bastis. And in Yoga Basti, it is very, very similar to Charaka. 1 Anuvasana Basti followed by 1 Niruha Basti. So there are 3 Niruha Bastis and 5 Anuvasana Bastis. Both in Kala Basti and the Yoga Basti of Kashyapa, they have only 3 Niruha Bastis. So this is just to make a note. There are only 3 Niruha Bastis, both in Kala and Yoga. Number of Anuvasana is more. In Karma Basti, there are 6 Niruha Bastis with 24 Anuvasana Bastis. This is the indication of Karma Kala and Yoga Basti according to Kashyapa. He tells the person having the Uttama Bala, where the Vyadi Bala is also Uttama, you have to go with Karma Basti. When it is Madhyama, you have to go with Kala Basti. And when it is Avara and in Kafacha Vyadis, you have to go for the Yoga Basti pattern. And in the another instance, we find this indications for the Karma Kala and Yoga Basti according to Kashyapa. He tells if a disease is Vasti Sadhya, so where 30 Bastis need to be administered, when you are sure that the disease can be totally treated with Basti. Then Sampanna, yes, the person should have a lot of, he should be able to afford the treatment, Sampanna. That's very important for Basti, because one thing, the medicines are expensive, and the Basti Parihara Kala is also the double the duration, where he cannot go through the mental or the physical exertion. So he should be Sampanna. Sahishnu, who can really tolerate a Balavan Rogi, and Gambira Dhatugatamala and Vata Bhoishta. So what we have to notice, it is indicated in Vata Bhoishta. That's why 1 Niruha Basti altered with 3 Anuvasana Bastis. So it is suitable when there is Vata is aggravated in excess. It is not the pattern of Niruha followed by Anuvasana. It is Niruha followed by 3 Anuvasanas. And in the beginning, the 5 Anuvasanas to combat the Vata and then take it for the Niruha. In Kala Basti, it is indicated for Sadhana Yukta, a person having the Madhyama Bala, and it is indicated in Pitta Samsrishta Vata. So wherever the Pitta is associated with the Vata, we have to go for Kala Basti. And Yoga Basti, the specific indication is Nati Tivra Bala Vata. When Vata is not aggravated in excess, when you are planning to treat the Kafanubandha in Vata Vyadis. So that's why it is considered as Laghu. The Yoga Basti, according to the Kashyapa, even the Charaka's Yoga Basti, it is considered as Laghu because there are only 5 Anuvasana Bastis and 3 Niruha Bastis. So when you take this thing, there are 3 Niruhas with 5 Anuvasanas. It makes the overall schedule of the Basti a Laghu, and it is used to treat the Kafanubandha Vata, or whenever you want to treat the Kapha diseases with the Basti, you can plan this. Then when to administer or how long to administer. So in the beginning, when you want to plan, there is no standard schedules for Basti. See, at the end of the Kalpasthana, what Charaka enumerates, after explaining the 600 Kalpas for Vamana and Virechana, he tells this is for the people who are having Alpa Buddhi. All 600 yogas are for the people who have a less intellect, who cannot formulate their own yogas for the Vamana or the Virechana. I'm just giving them a guidelines. Just giving them a guidelines how to formulate. Same thing is applicable for Yoga, Karma and Kalabasti. It is for a common practitioner, not for a specialist or an expert in Panchakarma. The Yoga, Karma and Kalabasti need not be planned. Because there are various references. See, look at the reference from Sushruta. He tells, Rukshasya Bahuvatasya Dvau Trinapi Anuvasana. If you are treating the Ruksha having the Bahuvata, largely aggravated Vata, don't start the Basti with 1 Anuvasana. He tells, give either the 2 or 3 Anuvasana Bastis in the beginning. Make sure that Snigdatanum Jnatva, make sure that the Snehana has properly happened. Then only you schedule the person for the Niruha Basti. It's important. So, it can be either 2 Basti, 3 Basti, it could be even 5 Bastis. As Kashyapa tells, 5 Bastis can be administered in the beginning of Karma Basti. Then, see, in the second shloka, it is regarding the Anuvasana Basti. He tells, after the Niruha Basti returns, After the Niruha Basti comes out, in the evening, don't give any food to the patient, because the time of administration of Anuvasana Basti is somewhere in the afternoon. If you are scheduling it with the Niruha Basti, after the Niruha Basti, the person will take the bath, then he will have the light food, and after the light food, you are going to administer the Anuvasana to him. So that is somewhere either in the Nisha Samipa Diva or Diva Samipa Nishi. That is the time for administration of Anuvasana Basti, classics. So he tells after the administration, don't give any food to the patient at night. He tells Vyushitaya. Vyushitaya means one who has just spent the time without taking any food on that day, has to be given food on the next day morning and in the evening. Then, depending upon the requirement, either you administer the Basti, Anuvasana Basti, either on Dvahe, Trehe or Panchame. So this gives a hint that Bastis need not be continuous. Once we are taking a patient for Anuvasana, every day we start giving them the Bastis. Today Anuvasana, next day Niruha and Anuvasana, otherwise only Niruha, next day again Anuvasana. No, he tells Bastis can be given once in 2 days, 3 days or 5 days. So Dvahe, how we have to understand, Dvahe is immediate next day. Dvahe doesn't mean that with a gap of 1 day. He tells Dvahe means you have taken the Basti today, after completion of 24 hours it becomes Dvahe. Then with a gap of 1 day it becomes Trehe. Then with the gap of 3 days it becomes Panchame. You understand? That is how the Bastis need to be scheduled. And how to understand when to administer this? He tells Dvahe Anuvasane Ati Prabala Vatasya. When there is lot of aggravated Vata in the Sharira, every day the Anuvasana Basti should be given. Anati Viruddha Vatasya Trahe. It should be administered once in 3 days when there is no Prabala Vata. And Panchametu Pravriddha Kapha Pittasya. When there is an aggravated Kapha and Pitta, the Basti Anuvasana should be administered once in 5 days. Once in 5 days means with a gap of 3 days. Today's first day, then there is a gap of 3 days. You give the Basti on 5th day, that becomes Panchaha. You had a doubt in this, right? Trahe means you give the Anuvasana Basti today, give a gap of 1 day, then you administer day after, it becomes Trahe. Dvahe means you have given Anuvasana Basti today, after 24 hours. When you are giving the Basti, it becomes Dvahe. So every day the Anuvasana Basti is indicated for the person who has a Ati Prabala Vata. When it is Nati Prabala, it is Trahe, and when this aggravated Kapha, it is once in 5 days. Similarly, the same rule is applicable for Niruha also. So when he tells once in 5 days, most probably we can even think of one Anuvasana followed by 3 Niruha Bastis, and again on the 5th day you give an Anuvasana. So it is left to the yukti of the physician to plan. Need not always stick on to Yoga Kala and Karma Basti patterns. Again, what matters here is the Agni. How is the Agni Bala of the patient? So if somebody is Ruksha, are indulging in the Ruksha Aharas every day, having a Deeptagni, suffering from a Vata Vyadi, or where you can note there is an aggravated Vata in the Vankshana, Shroni, Pradesha, they are suitable for Sneha Basti every day. It is Dine he tells, means every day they can be given Anuvasana Basti. Atho Anesha, in other case, otherwise, if they are not suffering from the Vata Vyadi, they are not Ruksha Nitya, not Deeptagni, he tells Trahat Prayaha. You have to give administer the Anuvasana Basti only once in 3 days, not every day. Make it a point, it's important, not every day, it's only with a gap of 1 day. And the reason he tells Trahat Prayaha Sneham Pachati Bhavakaha. He tells only by 3rd day the Sneha is digested. Prayaha, why he uses that word? Otherwise, if somebody is having a Mandagni, not even on the 3rd day, it is on the 5th day. That is the meaning of Trahat Prayaha. In most of them, you can plan the Anuvasana on the 3rd day. The people with the Mandagni have to be planned Anuvasana on the 5th day. Yes?
Can I ask? Ma'am, actually in practice we are giving half the dose of Anuvasana which is mentioned in text. So can we continue in...
Sir, we are even giving the half the dose of Niruha, right?
Yeah.
Yes. What we have to remember here is the Dwadasha Prasatika Basti is told for a person having the 124 Angula height, which approximately comes around 7 feet. Actually, nowadays because the Bala has reduced and maximum we see my height is 5'6". And I have a very good height. Most of the people we see are 5'2" or 5'3". The dosage needs to be reduced. Okay? So, Ato Anyesha, so he tells, we know that the Sneha doesn't come in contact directly with the Agni. Then why he tells Sneham Pachati Pavakaha? He tells it has been digested by the Agni. Chakrapani explains this, quoting that the Sneha, whatever we administer, it does the Upalepana in the Pakvashya. And that is digested by Bahir Nisrita Ushma of that part. So Bahir Nisrita Ushmena Pachati, he tells. Pakvashayopalepakam Bahir Nisrita Ushmena Pachati. If you look into the commentary of this. So that will become Manda actually. Then even if you are administering the basti, the medicine will not be absorbed and get into the circulation. So that is the reason he tells, give the Niruha bastis in between and make sure that the Anuvasana is properly digested. So maybe, it's a thought, maybe when we are treating the Vata Vyadis, like either we can give 2, 3 or up to 5 Anuvasanas in the beginning, followed by either 1 Niruha and 1 Anuvasana regularly, or 1 Niruha followed by 2 to 3 Anuvasanas alternatively. And whenever we are ending, taking care that it doesn't lead to Vata Prakopa, we can end it up to 5 Anuvasanas at the end. So it can be thought of. So even in the practice when we are giving, for example, we come across with the patients for Staulya, or where we are going to plant the Lekhana bastis. And we don't even add the sufficient amount of the Ushakadi Ganas. So what is the concern there? Whenever a person develops an irritation in the rectal mucosa, a burning sensation in the anal region, Anuvasana needs to be given. Otherwise, every time after a Niruha, if you start giving the Anuvasana, the weight reduction will not happen to the expected amount. So that's how we have to plan. So in Vata Vyadis, we have to concentrate more on the Sneha Bastis, whereas in Kafacha Vyadis, we have to concentrate more on the Niruha Bastis. So this is just for an example. Don't take it as a distraction. It is just a fact to make you people aware of. Have you ever heard about the Kellogg's enemas? Kellogg's, he is Kellogg, a scientist. His concept was every person suffering from a disease needs to be given an enema. He should be hydrated both from the upper root and from the lower root. And after the administration of the evacuant enemas, they should be given a pint of yogurt. This was a concept developed by Kellogg. Yogurt, a pint means it is approximately around half kilo actually, out of which one portion was administered orally and the left portion was administered rectally after the evacuant enema. This is a concept by Kellogg's, and he believed that he is going to plant the protective germs where they are most needed and may render the most effective service, because after the enemas it will act on the bacterial flora, the microbes will be affected or they'll be washed. So he believed that because they don't have a concept of medicated enemas, this was like a very earlier concept of 19th century where they were using the salt water for the enemas. So after the salt water, he made sure that the yogurt will be introduced both orally and rectally. So he gave the yogurt, which is very similar to our takrabastis. So this is the Kellogg's concept to clean the bowel and to implant it with the healthy germs. The next point I have taken is the time for administration of the Niruha and the Anuvasana bastis. Charaka explains it is like in the morning when the person is Natik Shudhartha. That is the time for administration according to Charaka, whereas Sushruta and Vagbhacha explains it to be in Madhyana. So no doubt the Abhyanga Sveda, everything needs to be followed before the Basti, but in the Madhyana it should be given. This is the concept according to Sushruta and Vagbhata. Madhyana is noon actually. So yes, so Madhyana 12 o'clock. So usually there is a practice of administering the Niruha Bastis, especially the person who cannot tolerate hunger. So sometimes what happens is we'll have in our hospitals around 20 to 30 Niruha Bastis in a day. The therapists are overloaded with the procedures. First thing, they don't mix the Basti Dravyas properly. And the people will have their turn for the enema somewhere around 9 o'clock or 9:30. And they are very, very hungry. Actually, this is a contraindicated time for the administration of Niruha Basti. Either it should be administered in between 7 to 8:30 in the morning, or it could be administered in between 11 to 12:30 after having a light breakfast in the morning, somewhere around 8 o'clock. So there should be a minimum gap of 3 to 3.5 hours between the morning breakfast and the Niruha Basti administration if you are planning for the Madhyana, because what is important is Natik Shudhartam. They never tell like it should be administered in empty stomach when a person is not having very good appetite. So usually the emptying of the stomach contents will happen after 3 hours. So once it happens, the Niruha Basti can be administered. So that can be considered as a standard time if you cannot give in the morning, in between 7 to 8:30, because after 8:30 most of us are hungry actually, and because they are the evacuant enemas, most of our enemas, so it will be very tiresome when you are administering them to the aged people. So you can always advise them to have a very light food in the morning, otherwise light food with milk, and later the bastis can be administered in the Madhyana. So 11 to 12:30, but not beyond 12:30. Afterwards, like it becomes like an aparanna, which is again a contraindicated time for the administration of basti. That is, the first one is according to Charaka, that is Natik Shudartham. That's the basic principle while administering the Niruha Basti. There is an exception. The exception comes to Vaitarana and Kshara Bastis, and this can be applied or generalized for all the Tikshna Bastis when you are administering it to Durbala. There is a concept that for the children, for the aged, and for the Durbala, only the Mrudu Basti should be given. But whenever a condition for the requirement arises, they have to be given with the stronger bastis like the Amavata or the Kshara Basti, which would be very effective in conditions like either the Kafajagridrasi or with the Amavata, etc. And the time of administration is Bhukte Chapi Pradiyate. Bhukte Chapi Pradiyate, they have to be administered after the food. So this is one exception for the administration of Niruha Basti. And the time of administration of Anuvasana is the evening. He tells, after the Niruha Basti Pratyagamana, patient should be given Shali with the Mamsarasa, and after the digestion of it in the evening, the person should be advised to go for a light food, and then the Anuvasana Basti should be given. There is one common mistake which is generally done while administering the Anuvasana Bastis and the Matra Bastis. You know what? Patient is first asked to take food. Isn't it? Patient is first asked to take food. After taking the food, we give the Sthanika Abhyanga, followed by some variety of the Tapas Veda. Then we give the Anuvasana Basti. It's a wrong method. In Anuvasana Basti, first you should give the Abhyanga and Sveda. Then you should ask the patient to take the food. Then you should advise the patient to walk for few steps. Usually they should count the steps like 50 to 100 they should walk if they are capable of. Then immediately when it is still the Ardra Hasta, the Basti should be administered. So Abhyanga should never be done after the food. Abhyanga first, then the food, and then the Basti. There are different time periods for Anuvasana. Just like Sneha Pana. Sneha Pana, when we think of the Shamana Sneha, there are 2 kalas for Shamana Sneha. One is in the morning and one more is in the evening. That depends upon the Rutu. That also depends upon the Doshic predominance. A similar principle has been told here. So he tells in the Shita Rutus, Anuvasana should be given in daytime. Whereas in Ushna Rutus, the Anuvasana should be administered in night time. Ratro, he tells, that doesn't mean Ratri exactly. And for Ratri, you can see when they explain Dina, in the daytime, he tells Diveti Nisha Samipe Diva Bage, like somewhere around 4 o'clock or 4:30. Or Ratravapi, if they are telling it is Ratri, it is Dina Samipam Ratrav, somewhere around 6 o'clock. This is the time for the administration of the Anuvasana Basti, either depending upon the seasons or depending upon the Doshic predominance. Anuvasana Basti is strictly contraindicated at night. I have observed, like the few private practitioners, they do administer bastis at 8:30 or 9 o'clock at the night. The important reason being, they can be given various external Panchakarma procedures in the daytime, because after the Anuvasana Basti, you can't put them on any procedures, right? By 3 o'clock if you give, or 4 o'clock if you give the Anuvasana Basti. So they'll have plenty of Panchakarma procedures in the daytime. Night after the food, they'll give the Anuvasana Basti and make the person sleep. That's a wrong habit. That's very wrong. He tells, Ratrau bastim nadadyatu. He tells in night the anvasana or the sneha basti should never be given because doshotklesha is noted in the ratri, and this utkleshita doshas, they get combined with the snehas which are administered in anvasana basti, leading to atmana, gaurava and jvara. This practice, like giving night the basti is there, it is there for snehapana also. They give the snehapana at 6 o'clock in the evening. Many practitioners 6 o'clock in the evening because it is very easy. They'll ask them to skip the food. So only for 2-3 hours he has to follow the pariharya vishayas. Later the person can sleep and by next day morning it is digested. It's a wrong practice because they take up a point that yes, Shamana Sneha 2 kalas are there. In the evening also it can be administered. It's only for Shamana Sneha, not for the Shodhananga Sneha. So including the basti, they should not be administered at night. Then he tells what happens in the daytime. Daytime he tells the doshas are situated in their own sthanas. The Agni is combined with the essence of the food. And the Srotas is open because of the effect of Agni. So that is the time to administer the Sneha Basti so that the Sneha Basti can easily enter into the Srotas, trapped all over the body and can result in the Dosha Shamana. This is an exception, but when a person is having great increase of pitta and decrease of the kapha, it can be given at night during the Ushna Rutus because the daha, the lakshanas are generated usually towards night in pitta, so it can be given, he tells. Most of us are aware of Dvikala Nasya, right? There is Dvikala Basti also. Dvikala Basti, it is pertaining to the Sneha Basti. Sushruta explains where there is Vatadikya in the patient and the patient is suffering from Tivra Ruja, Anuvasana can be administered both during the day and night. He tells one Anuvasana can be given in the morning and one Anuvasana can be given in the evening. Just like how we do the Dvikala Nasya, this can be considered as a cross reference to do the Dvikala Bastis. Have you heard, this is a very, very popular this thing, enemas with the fecal matter, actually. Enemas with the fecal matter to transplant the healthy microbiota to the rectum or to the colon, actually. So this was a very popular principle followed for ulcerative colitis. It was so popular. Actually, we are not aware, that's all. It started from 1958 and it was a popular method till 1989. Not too old, just before few decades. It was popular till 1989 to transplant the microbiota to the colon. This procedure is called as fecal microbiota transfer. You will be surprised to know there was a transfer method even orally. Earlier, the fecal microbiota transfer had two routes. One is the oral route, the one more is the rectal route. There was a famous doctor, I don't remember his name, he used to prepare a liquid called golden soup. It was also known as yellow soup, which is nothing but the fecal matter of a healthy individual diluted with the water which was given to drink. Like a very old concept of using the probiotics, isn't it? It is taken in a capsule form. It was just given directly as a liquid. It is known as a yellow soup or a yellow the liquid, actually. What they do is in the rectal route transplant of the fecal microbiota, they screen a person. They screen a person to rule out any infections, and once it is confirmed that he is healthy and not suffering from any known infections or the diseases, the 100 grams of the fecal matter is collected from an individual, that is diluted with 500 to 600 ml of the normal saline, and that is given to the patient. These are the retaining type of the enemas, where the enemas are introduced either with the drip method or the drop method so that they can be retained inside for a longer duration, and it is believed that the healthy microbiota is achieved. This was very popular till 1989, but afterwards they started doing the procedure by using a colonoscope. So colonoscopy method of FMT became more popular, and what is the plus point in colonoscope is the entire colon and the ileum can be, the transplantation of the microbiota can be done, whereas with the enemas it reaches up to the splenic flexure, so only the descending part of the colon will be transplanted with the microbiota. So that made it to decline, but it was there as a very, very popular treatment modality for almost 3 decades. 3 decades it was there in the starting from the middle of the 19th century to the 20th century, it was there. Coming to to the point, how many bastis need to be administered in a day? I said there is a reference to practice of Dvikala Sneha Basti, but when it comes to the Niruha Basti, how many bastis? Most of the presenters quote it only to understand how the bastis should be planned for Vata, Pitta and Kapha. Like the dravyas having the Snigdha and Ushna should be used for Vata, then the Swadu and the Shita dravyas with the Kshira should be used for Pitta, and Katu, Ushna and Tikshna dravyas should be used along with Gomutra for Kapha. You should observe Yekaha, Dvau and Trayaha. It stands for when you are treating a Vata Vyadhi, Snigdoshna Yekaha Pavane Samamso. So, in Vata Vyadhi, one Niruha Basti should be given with Snigdha Ushna Dravyas added with Gomutra as an Avapa. When you are treating Pitta Vyadhis, it should be formulated with the Swadu and Shita Dravyas, either using the Kshira Kashaya or using Kshira as an Avapa. 2 Niruha Bastis should be given. It is Dvau, he tells, 2 Niruha Bastis. Trayaha Samutraha Katukoshna Tikshnaha. With the Katu and Ushna Dravyas, along with the Gomutra, the 3 Bastis should be administered for Kapha. And he tells, Naparam Videyaha, not more than 3. This is the opinion of Charaka. Sushruta tells, even the 4th can be administered. Naparam Videyaha. It stands for the 4th Basti should not be given, as there is no 4th dosha. There are only 3 doshas, right? So only 3 bastis. The question is whether they have to be administered in a day or whether they have to be administered continuously. So you can think it in both the ways. In Vata, when you are planning or scheduling the basti, it is 1 Niruha Basti followed by few Anuvasanas. In Pitta, if you are giving basti, there could be 2 Niruha Bastis with few Anuvasanas. In Kapha, when you are giving basti, there should be 3 Niruha followed by 1 Anuvasana. That is one thing. Second thing, you can get a cross-reference. When Charaka explains the Balaguduchadi Basti in the Siddhisthana 3rd chapter, he tells the amount of the drugs which are required for the preparation of the Basti Dravya, it is meant for 3 Putakas. Means with that, 3 Dvadasha Prasritika Bastis can be prepared. Not 1, 3. So he means one after the other. When you are treating a Kaphaja Vyadhi, you administer 1 Niruha, wait for the Pratyagamana. After the Pratyagamana happens, give the 2nd Basti. Once the Pratyagamana of the 2nd Basti happens, give the 3rd Basti. So in a day when you are treating the Kaphaja Vyadhis, to maximum you can administer 3 Niruha Bastis, depending upon whether a person develops the Suniruda Lakshanas or not. I feel such principles should be adopted by the Panchakarma practitioners to make it a special branch. Isn't it? We are just following the KC people. Because for most of the seniors who taught the subject was KC teachers. So whatever was there in practice, we are just blindly following. We are not making use of this speciality. I strongly believe this. My HOD always used to tell, Panchakarma is not a subject for specialization. It is not meant to be a part of MD. They have done an injustice by opening MD in Panchakarma because it is always meant for super specialization. It's not a part to be specialized, super specialization. Somebody specialized in KC should take up a Panchakarma as a super specialization. Or somebody who is specialized in Shalakya or the Shalya should take up Panchakarma as a super speciality. So only then the subject can flourish. The thing what we are doing is we are just blindly following whatever is there in the practice without using any yukti or the rationality. It was there, Yoga Basti was there. I too write Yoga Basti, isn't it? We never use the Dviputaka or the Triputaka Bastis in practice. So this is according to Chakradatta. He tells even the 4th Basti can be given in a single day. If you don't see the Samyak Niruda Lakshanas, there is nothing wrong even in giving the 4th Bastis. But Charaka strictly contraindicates not beyond 3 Bastis. So this is the thing. So what is important is if the dosha nirharana has not happened and if the samyak niruda lakshanas are not noticed, then only the 2nd, 3rd or the 4th niruha basti should be given. Chakrapani explains why the 2nd and 3rd bastis. He tells, Eko apakarshati anilam swamargat pittam dvitiyastu kafam tritiyaha. So there is a detailed commentary, I don't want to go through that. He explains like, here we are going to treat the swamarga sthita pitta or kapha. As popularly are very well understood, basti is indicated for the vata or when the pitta and kapha along with the vata when they come and stay in the pakvashaya, the basti is indicated. So when they are in the margasthita of the vata, when they are situated in the pakvashaya, one basti may be sufficient to eliminate the doshas. But when they are swamargasthita, it is not a very popular treatment for the swamargasthita pitta or kapha, because it's always the vamana and virechana. For swamargasthita kapha, it is vamana, and swa ashayasthita pitta, it is virechana. It's not popular, but sometimes when it is required, when the vamana or virechana cannot be done, even for the swamargasthita pitta and kapha, if you want to remove them through the niruha bastis, then one putaka is not sufficient. Either you have to give 2 for pitta and 3 for kapha is the principle here.
It is necessary to do snail serum for every basti.
Yes, sir.
It is necessary to do snail serum for every basti.
It is necessary to do, sir. It is necessary to do even for the nasya. But for example,
If we are giving 3 continuously niru basti, that time.
because the Abhyanga and Sweda are believed to help the doshas to come to the sthana and then easy for the elimination, and each basti nirharana will take around 30 to 45 minutes. It is important to do the sthanika Abhyanga and Sweda, followed by that the basti.
Once we done snail serum,
It's not the full body. Need not be full body. It is only sthanika. You meant the Abhyanga and the steam, right?
my question is that Spanish snail serum, then niru basti, niru basti pratyagavan. Then again we have to do second niru basti. That time we have to.
It is better to give. It is better to give. We know the bastas being employed to treat the different doshas and the dhatugata malas. But have you ever heard it being used as a part of punishment? The punishment, to punish somebody using the enemas. They are called as punitive enemas. Punitive enemas, you employ them for the punishment. It was widely used in Argentina actually. So in punishment enemas also there are 2 types. Either you give a nutritive enemas or you give a purgative enemas. So for different people are the different accused, and depending upon what they are really doing, the nutritive or the punishment enemas were employed. In punishment enemas, mainly the pepper and turpentine was used. Pepper, you can understand, it is so strong and it will cause the rectal mucosa, the inflamed, lead to lot of burning sensation in the anal region. So it was used as a part of punishment to discourage any political dissent after independence. So in Argentina, and turpentine enemas are very harsh purgatives. So they were used for punishment. Apart from that, the nutrient enemas were used by the CIA. So if somebody goes on a hunger strike in jails, if somebody goes on a hunger strike telling that the facilities provided in the jail is not good, that this, after 2-3 days when the dehydration starts, they were forced to take the nutrient enema. And the punishment is, the officers were choosing the biggest of the nozzle available. So it is very hard, so because it can damage the sphincters. So it is like, so one of the person who has taken the nutrient enema, he tells that you get a tube up to as you can, and largest evolved tube we had. So whatever the largest tube was available, that was used to give the punishment and the nutritive enemas. And they are called as violent enemas, are known as punitive. Punitive means punishment. Coming to diet during the basti, we don't give much importance to the diet during the basti when compared with Vamana or the Virechana, because in Vamana and Virechana what happens? The dravyas directly come to Agni Sthana, they do the Dushana of the Agni, so a person develops the Agni Mandya, so Peyadi Krama needs to be strictly followed. But during the basti, depending upon the doshic predominance, so either we use the Mamsarasa, Kshira or the Yusha. So when we are using Mamsarasa or Kshira or Yusha, it is always with Shali. So always with the shali, either the mamsarasa should be, meat soups should be used, otherwise the milk should be used with the shashtik shali or the rakta shali, otherwise the mudga yusha should be used in case of the kapha. So this is the treatment principle, and most of the Ayurvedic hospitals have become vegetarian. Actually, they don't use the mamsas and the mamsarasas very frequently. The diet becomes too vegetarian actually, which is against the principles of Ayurveda. Even if you look into the sneha pana, during the time time of Snehapana, there is an option to use Mamsarasa. If a person is suffering from a Vata Vyadhi and having the Deeptagni, Peya is not indicated for him. It is the Mamsarasa which is indicated during the time of Snehapana. So, we should not leave the principles considering that we are becoming too orthodox. Without Mamsarasa, Yapana Bastis cannot be done. Without Mamsarasa in the diet, the Vata Vyadhis cannot be treated successfully. What should be the quantity of food? So most of the times we tell the patient, you take the normal food, you take whatever you wish to take, apart from the salads or the fresh fruits, vegetables, etc. It is always the Hina Ahara the person should be advised for. Either it should be a Tribhaga, means 3/4 of the quantity of the food what he regularly consumes, otherwise half of the part. The Hina Bhaga of the Ahara should be advised to him depending upon the dosha and depending upon the Agni. And this is one more principle which needs to be adopted during the course of Anuvasana Bastis, that is using the water boiled with Dhanya and Nagara. Because whatever the Sneha which does the Upalepana in the Pakvashaya can be digested either by using the Ushnodaka, or if the person is having Mandagni at the reduced Agni, then that should be facilitated by using the Dhanya Nagara Siddha Jala. Recently I was just going through a couple of articles where in postgraduate studies they have tried this Arohana Krama Matra Basti as a Purva Karma for Vamana and Virechana, and they have shown the very good results also. Like the Shodhana happened well with good number of the Virechana Vegas or the Vamana Vegas, etc. So as there is Arohana Krama in Snehapana, there is Arohana Krama in Sneha also. Hope most of you are aware of the reference is from Deepika. The reference is from Sharangadhara. The commentator of Sharangadhara explains, starting from the 24 ml increased by 6 ml every day, it should be given for 9 days. So for 9 days he tells, again in that there is a Pravara, Madhyama and Avara Matra, starting from 1 pala increasing by 12 grams, and starting from 3/4 of a pala increasing by, like that there are different 3 different patterns for the Pravara, Madhyama and Avara. So that is the Arohana Krama. So they have used or employed the same Arohana Krama, and they have seen whether the Utklesh and Lakshanas can be achieved with that. But usually it's not ideal. It is not ideal because through giving through the rectal route, you cannot achieve the proper Kaphotklesh and Lakshanas which is required for Vamana, or the Mandakafa Lakshanas with, we don't consider Pitta Utklesha, but Mandakafa Lakshanas for the Virechana cannot be achieved exactly by giving the Arohana Krama, Matra Bastis or the Sneha Basti. Kashyapa also tells, Sneha Svedopapannanam Urdvam Chadascha Shodhanam, only after Snehana and Svedana, that is both Abhyantara and Bahya, you have to consider the Urdhva and other Shodhanam by means of Vamana and Virechana. Snehanam Natu Basti Bihi. You cannot achieve the whatever the Shodhananga Sneha produces, the Lakshanas cannot be achieved by giving the Basti. So in Pravicharana Snehas, among the 24 Pravicharana Snehas, Anuvasana Basti is there. That should be most commonly used for the purpose of Shamana or for the purpose of Brahmana in Vata Vyadhis, not for the purpose of achieving the Utklesha. You know, in Ayurveda, if somebody is very expert in planning the basti, or who is very good at formulating the bastis, they are called as Basti Visharadas. This is the title given by Kashyapa. Basti Visharada means someone who is very expert in planning the bastis or formulating the bastis. There is an equal job title held by the Egyptian priest for who were well versed in treating the rectal disorders, can be compared with the proctologist, or they were also well versed treating the diseases with the enema. They were called as, don't take it in a bad sense, they were called as shepherd of the royal anus. They were called as shepherd of the royal anus. So this was a strange job title which was held by several court physicians in the Egypt. And their principle was purge for health sake with emetics and clysters. We are all aware of the word enema, but you know, clysters is the basic word which represents enema. Recently, this word clyster has been replaced with the term enema actually. So clyster means enema. And even if you look into the civilization, the human civilizations, It is very surprising to know that enema was a part and parcel of their life, and it was there in very religious methods. If you look into the Mayas civilization, it was a part of their religious principle that, like in the gatherings or the assemblies, the priest, whoever is going to give any advice, will be administered with the enema containing the water lily and some other medicines, which will get him into the trance quickly. Actually, he becomes intoxicated. A sort of hallucination develops after such enemas, and it is believed that he's getting connected to the dead people, and whatever the words are coming out of his mouth, they are considered as very holy. It was there as a part of Maya civilization, and you can see there are a lot of pictures which depict the enema over their teacups, over the bowls or the plates. The enema has been come, and recently the enema art is gaining a lot of popularity. Enema wall art. If you search for the enema wall art, you see the couple of pictures for the enema actually. So a type of art has developed where enema will be depicted over the wall actually. And this is the indication for Basti before Virechana. Usually when we think of the sequence in Panchakarma, it's always the Vamana. If a person is suitable for all the procedures, then it is Vamana, followed by Virechana, followed by Basti. Basti is usually not indicated in Ashuddha Dehi. Means if somebody has not undergone the Virechana, they have been not indicated for Basti. The one indications or an exception for this is if the person is suffering from the Dhatukshaya Vata Vyadis, he need not go for Virechana. He can straight away start with Basti. There is a indication. But this is one rare indication. If a person is doing the Panchakarma procedures one after the other and has these lakshanas, then first the Basti should be planned and then the Virechana should be advised. This is for a person who is too ruksha, having too much of aggravated vata, krura koshta, and who regularly is getting involved in the Vyayama, having Deeptagni. So what happens in such conditions if the Virechana Aushadhi is given? The medicine will get digested without producing any desirable effects, like the purgations will not start. So in such conditions, first Basti, Tebyo Bastim Pura Dadyat, Paschat Dadyat Virechanam. So first you give the Basti, and after the Basti the Virechana should be given. So when you look into the commentary, there is a lot of discussion regarding which type of Basti should be given. The one opinion that Sneha Basti should be given, because you are going to treat the person having Ruksha, Bahuvata, Krura Koshta, Deeptagni, etc. So every day the Sneha Basti should be given, and that should be followed by the Niruha Basti. That should be followed by Virechana. The second opinion that the proper Niruha and Anuvasana Bastis in some specific pattern should be administered, because Niruhat, Pavanat, Bayam has been told. That is only when the Niruha Basti is used alone in excess, and it has nothing to do when it is combined with the Anvasana Basti. So a proper Basti should be given comprising of both the Niruha and Anvasana Bastis, and then we have to plan for the Virechana.
So ma'am, on the 3 rest days we will use this?
No sir, it is not to use the Bastis during the 3 rest days. First you plan one complete schedule for the Basti, and after 7 days of the gap you are going to plan the Virechana. He doesn't tell the exact Parihara Kala need to be followed. Parihara Kala is if you are giving 8 days of Basti, then 16 days of Parihara Kala is there. That need not be followed. As it is a principle that either the Niruha or the Virechana should be given with a gap of 7 days. So on the 9th day you can start the Snehapana here. See, he tells Basti Danat Urtvam Sapta Ahana Antarameva Bhavishyati iti na kaschid virodaha. So it is not during the resting period. Definitely not after the Snehapana. This is related to the temperature of the Basti Dravya. So it has been always told in the classics the Sukoshna Basti should be used. The temperature is somewhere around 36 to 40 degrees centigrade depending upon the season, the temperature in the weather, etc. But there are a lot of indications to administer the Shita Bastis too, which we usually don't practice. For example, when the Pittahara Bastis are told, Charaka always advises Sushitam. You give the Bastis which is Shita. Which is Shita means not with the not refrigerated, normal temperature. Once the Basti Dravya loses its temperature, it becomes normal, then you have to administer the Basti. And even in case of Kshira bastis and all, it is advised to give the Shita bastis when you are targeting on Pitta. This should be specially applied in case when a person is suffering from the Pakvati Sara or the irritable bowel syndrome or the ulcerative colitis actually, because the retention period is not very good, because they always have the Adho Marga Pravritta doshas. So after the administration, within no time, usually like during the administration itself, sometimes the patients will feel an urge to defecate. Otherwise, it usually comes back within 5 minutes. Then it will not serve the purpose, especially in ulcerative colitis and IBS, because the rectal mucosa is so irritated. Sometimes it could be with the ulcers, the bleeding tendencies. You have to give the enema which targets that part. It stays there for some time so that you can achieve the good results. So in such cases, when Takra bastis need to be administered, it can be Shita. So there are few points regarding the mode of action of basti. I'm not going in detail actually, just like how the basti dana vidhi etc. were not explained. Mode of action, there are various theories nowadays. I know all of you are aware of the ENS, its relation to the bastis, and the administration of the Sneha Dravyas in the rectal route, etc. When we are giving the Matra bastis or the Anuvasana basti, what we have to understand is the rectal compliance. Rectal compliance is nothing but the capacity of the rectum to hold the fecal matter. So once it is beyond the rectal compliance, the dravya will come out. This rectal compliance will vary from individual to individual, from race to race, from men to women actually. So if you are thinking of the retention of the basti for a longer duration, it should depend upon the rectal compliance. The average rectal compliance is around 50 ml. 50 ml. That's how the Matra bastis or today's Anuvasana bastis for the good retention, they are given around 70 ml actually. So beyond this, it stimulates the defecation reflex and it comes out. So that we have to always remember. I think today you wanted to go for a round in the city or go near the seashore. So yes, these are the various references you can see in the classics related to the mode of action of bastis. And Vagbhata tells that the basti acts on all the subtypes of the vata. So once the Sneha basti or the basti is given, it will act on apana vata, then apana vata to, he tells the samana to udana, then the prana and the vyana. So all the vatas will get subsided one after the other, leading to good results. And this is a correlation given like how will the basti act. Like as sun can dry up the rasa or the liquid portions from the bhumi, similarly though the basti is administered, will stay below the grahani bhaga or the pakvashya, it is capable of acting by its virya. So once the virya of the basti is absorbed, it enters into the systemic circulation and it acts. And vata is considered as the Ishvara, and even if there is a Sannipataja rogas, vata is the most prominent one. So the Ativruddha vata will kill a person just like a visha, so that has to be balanced with the Niruha and Anuvasana bastis. This is in brief to explain. The Samyak Pranihita basti reaches the Pakvashya, Shroni, and stays near the Adhonabi. Then Vastivirya from the Pakvashya will spread all over the body, just like when the Vriksha Moola is watered, how the water is transported into the end part of the plant, like, and bestows with the good leaves, flowers, fruits, etc. Similarly, the basti will also be transported, and by this we can do the either harana or shamana of the vata, the doshas. Either you can do the shodhana or shamana. Then it removes the mala and imparts virya to apana vata, followed by subsidence in the subtypes of the vata. And these are the effects of the Mastishka, like acts as a good emulsifying agents, what are its benefits and all those things. And this is related to the Saindhava. Without the Makshika and Saindhava, you can never think of the Basti. And Sneha, especially when it is impregnated with the specific materials which are used for the Basti, it will be very helpful. And Kalka and Kashaya. Yes, because ENS you could have heard in a couple of the presentations, I just want to highlight regarding the gut microbiota, also called as the gut flora or gut microbiome. It is the microbial composition of the gut, and it varies across the regions of the digestive tract. So whatever the microbiota is in the small intestine is not very similar to large intestine at the end part of the intestine. So the colon contains the highest microbial density recorded in any habitat on earth, representing between 300 to 1000 different species. So when you think of the gut microbes, there are 300 to 1000 different species. However, 99% of the gut bacteria come from 30 to 40 species. And it is estimated that the human gut microbiota have around 100 times as many genes are there in the human genome. So the main functions of the gut microbiota includes direct inhibition of pathogens. So it will help in developing the immune system, and it helps in the metabolism, and it plays also a part. We have heard about the ENS, but this is also one major part to stimulate the gut-brain axis. It is called as gut microbiota brain axis. So when you look into its actions, you can think, as it plays an important role in the immunity, bastis are very, very useful in treating the autoimmune diseases. As it plays a very important role in the metabolism and the absorption, actually. That's how it is indicated from lean to obese. It can make the krisha, it can promote the weight, as well as in the stout, it can reduce the weight, actually. So, and also, it is a direct relation with the central nervous system development. So, its role in the diseases, we'll see. They have analyzed the malnourished children and their gut microbiota, actually. It is very less and diverse when compared to the healthy children. So gut microbiota plays a very important role in the absorption, actually. So malnourished children, they don't have much diversity in the microbes. Then the neurodevelopment, neurodegenerative, and the psychiatry development. It's always said, no, you are what you think, what you eat. Isn't it? Whatever you think, you become. Whatever you eat, that reflects on your health. See, there is a direct relationship between the gut microbiota to your mood. Anxiety and depression are more common if the gut flora is damaged. He tells that the psychiatric disorders and the neurodegenerative disorders are related to modifications in the amount of gut flora. And there is an association between the microorganisms and the most prevalent forms of neurological diseases, including the Alzheimer's, multiple sclerosis, and schizophrenia. And this bidirectional communication of the gut microbe and the CNS is known as microbiota gut-brain axis. Because ENS mainly speaks of gut-brain axis, this speaks of microbiota, its effect over the gut and its effect over the brain axis. Nowadays, the researchers are going on all over the world to understand what is the relation of microbiota to various diseases. It is definitely disturbed in many autoimmune diseases, including the allergies, the rheumatoid arthritis, the asthma, or the skin diseases like the psoriasis or the eczema. Wherever the autoimmune comes, this gut flora is definitely disturbed, is the new understanding. So a dysbiotic state of the gut microbiota is becoming recognized as an environmental factor that interacts with the host's metabolism and has a role in pathological conditions, both systemic like obesity or diabetes, and atrophy, and gut-related IBS and IBD. Nowadays, there are a lot of researches going on in the allopathy science related to the administration of nanoparticles for ulcerative colitis, actually. We are one step behind them. Though we have a very good literature related to the bastis, the different varieties, they are one step ahead of us, actually. Because now they have understood this could be a very good method of administration of the medicines. As there is an IV, yes, the rectal route can also be used to equivalent to that for the nutrition, especially in colonic cancers or where the IV infusions cannot be done. In casualty, the rectal rehydration is a first step to take care nowadays. And there is a lot of scope for further research when it comes to Ayurvedas, to develop instant vasti pouches. The main drawback is, if I am asked to formulate one Erindamula di Basti, my choice of Sneha is different. Your choice of Sneha is different. The quantity I fix for the Kashaya is different, yours is different. I may prefer it for the Kshira Kashaya, you may prefer the plain Kashaya. Avapa, I could use Kshira, someone could use Komutra. Because of this different practice, there is no standard protocol. It is a failure. developing basti pouches, the instant basti pouches. I may prepare a basti with Ksheerabala Taila or the Gugulu Tiktaka Grita. You may not prefer it. But there is a lot of scope for research if the ready available pouches are there. Because see, even after there are 200 plus bastis in Charaka, how many do we hardly practice? 20 bastis? 30 bastis? So what makes it different is the combination of snehas. That is the only one different part. If you can standardize, okay, for this is this particular grita or the sneha would be my choice, and prepare the basti pouches, it would be of a great help. Then this retention enemas, we never thought of a retention enema. In classics, whatever has been told, it's all the evacuant enemas. Even those, the picha bastis or the takra bastis, etc., they're evacuant enemas according to Ayurveda, because we expect that to return within 48 minutes. But for a better drug absorption in such cases and for the better results, we can think of the retained method of enemas. So for a drip method, maybe with the animal experimentations, we can start and go with the drip method of the enemas. And using rasaushadhis in bastis, it is there in practice. For example, when we are preparing the picha basti, we can add this Panchamrita parpati. The powdered Panchamrita parpati is added and the basti it would be more effective. When we are thinking of some vata vyadis, is a very good vatahara rasaushadhi can be added, and the basti can be formulated for the better benefits. So using rasaushadhis in the basti, we have to develop like how we have to do, maybe with the toxicity study in the animals, we have to, because it is not there in practice, because modern people have already started using the nanoparticles. And to study and analyze the gut flora after various bastis, what is the action of different bastis? See, starting from the Gomutra bastis to the Takra basti, we have variety of bastis. Starting from being acidic to alkaline, lot of bastis are there. What is their effect exactly over the gut flora? How it acts? When we give the Lekana basti, how it acts? The main problem is funding. We don't have the sufficient funds to take up such research works. Then to analyze and to understand the pH of various bastis, to understand exactly what would be the pH when we prepare a Kshara basti or Lekana basti or Vaitarana basti or Kshira bastis, and if we could bring up a concept how it exactly get absorbed in the rectal mucosa, it would be good. And to develop the standard schedule patterns for various diseases. These are some different research articles. This is one I wanted to highlight. This is one protective effect of picha basti in the acetic acid induced ulcerative colitis in B6 mice. This is taken from our department for the animal experimentation. We are about to submit this project reports actually. So we know that the picha basti is very effective in ulcerative colitis, but we exactly don't know how it acts. We don't know. And the human experiments at the clinical study will seek a lot of money to go through, because here we have a very standard parameters, because nowadays the oxidative stress has become very common, and that is considered as a theory behind generating the ulcerative colitis. So we have go for the DNA studies. The colonic mucosal antioxidants we have analyzed before and after the bastis, and the microscopic histopathological study has been done, and the initial experiments have shown there is a very effective role of picha basti both in the prevention and in the curative aspect. So in the prevention aspect, what is done is, because you know the ulcerative colitis relapses, so even if you treat after 3 to 6 months, depending upon the weather changes, depending upon the food changes, it comes back. So whether there is any preventive role of a basti in ulcerative colitis, we have tried with animal experiments. So initially we have given 16 days of basti, the Kala basti pattern, followed by induction of the colitis by using the acetic acid. So we have analyzed the whether it was good in rats where the picha basti was not given, or whether the rats which have been given with the picha basti resisted the development of acetic acid induced colitis, has been analyzed histopathologically. And in the curative aspect, first we have introduced the acetic acid, colitis is induced, followed by that the Kala basti is given, and this is compared with the standard drug of modern. In modern, for ulcerative colitis, there is a melasalamine enema. So same has been compared with the ulcerative colitis. And this is the article, when administered with the basti putaka and with the enema pot method, what were the differences. I'm not going to highlight in detail, but on an average you can see like the retention period when it was administered with the Putaka, using the Basti Netra and Putaka, it was around 12.4 hours, whereas in Sinich method it was 5.95 hours. And similarly with when X-ray they have taken, it was up to the ileocecal junction, and the retention period of Niruha Basti was higher in case when it is administered with the Putaka method, the maximum being 28.67 minutes, and in the Enema Can method, the maximum is around 14.17 minutes. So this is the X-ray showing which is administered with the classical method and the contemporary method. And this is one article I found regarding the Churna Basti. There is Rasnadi Churna in Charaka which can be used for the preparation of the Basti. So you have to take the Churna, mix it with the hot water, and you can administer the Bastis. There is one description of Hingvastaka Churna Basti. In Chakrapani Tika, you come across the Hingvastaka Churna. That is like advised when a patient is suffering from severe Mandagni, where the oral administration of the Pachana Deepana can also be not done, because that becomes a burden for the Agni to digest the Pachana and Deepana Aushadhis also. In that case, he tells like the Hingvastaka Churna can be taken mixed with the Ushna Jala and it can be administered to facilitate or to improve the Agni. This is a Churna Basti which is advised in Amavata. Again, this Rasnadi Churna is specifically like what the ingredients which have been told by Charaka, the Rasnadi Churna Basti in the management of RA. And see, this is how they have formulated with the Ushna Jala and Dhanyamla without Madhu or without the Sneha Dravyas. Because this is Amavata, just take the Churnas, mix it with Ushna Jala, do the Avapa with the Dhanyamla and administer instant. Quickly you can prepare and you can administer for the pain management in Amavata. Yes. With this I complete.
There are no direct recommendations regarding the Deepan Pachan Chikitsa,
Yes.
the administration of Anuvasana Deepan Basti. Whether we can do in the clinical practice.
Deepan and Pachana.
Yeah.
It is extremely important because if you look into the classics, Niruha Basti is not at all indicated in Mandagni.
Yes.
He clearly tells, Anuvasana Basti, Anuvasana is never indicated in Mandagni. He tells like Mandagnim, Mandataram Agnim Kuryat. If you are giving it to a person having the Mandagni, it makes it more Manda. It is not indicated actually. However, Niruha Basti can be indicated in Mandagni. Specific like some Churna Bastis or some Tikshna Bastis, they themselves can be used for a purpose of Pachana and Deepana. But as Niruha Bastis cannot be given alone, they need to be added with Anuvasana Bastis further. It is always good if you give some Pachana Aushadhis for Ama Pachana and then start the Basti Chikitsa. This is like with my clinical exposure and this experience I'm telling. It is because in Agnimandya will increase once you give the Anuvasana Bastis, and sometimes the Amati Sara will start. Then you have to stop the Basti Chikitsa itself. So it is always advisable to have the Pachana or the Deepana Aushadhi depending upon whatever is required. Either the Mrudu Deepana can be given or sometimes a longer duration of Ama Pachana is required before starting, especially in Vata Vyadis. I'll tell you, because Vata Vyadis will give more number of Anuvasana Bastis, and if somebody is having, and their Agni is always Vishama most of the times, and if it is Manda because of any disease or the pathology, then the Sneha will not be absorbed. Then it will not serve the purpose. So better in Vata Vyadis also, for some duration, give the Pachana, then start or plan the Basti.
The duration of the Deepan Pachan Chikitsa, that means the till attainment of the Samyak Deepan Pachan symptoms.
Till the attainment of Samyak Pachana. It is for Pachana. Okay? Deepana you can always limit depending upon whether the person is having Mandagni or Vishamagni. You can always limit yourself for the days of Deepana. Whether you want Mrudu Uttejana or you want the Madhyama Uttejana for the Agni, you can make it as minimum of 1 day to a maximum of 5 or 7 days Deepana. But Pachana, it doesn't come with any duration. It depends. And specific Pachana should be used. For example, if you are targeting a Vata Vyadi, the best Pachana would be Rasna Saptaka Kashayam rather than going for any other medicines. Otherwise, you can even think of using using them as a method of Fanta. So you can always use the Fanta, regular use every day, and then you can start with the Bastis. But during the course of the Basti, you just get adhered to Dhanya Nagara Siddha Jala throughout the day. That will take care of the Agni.
Ma'am, with Lekhan Basti, I was having bad experience. I used half of the dose which is mentioned in Shastra, half that Ushakadi.
Ushakadigana.
But ma'am, patient was having severe burning sensation and some inflammation was also observed in whole anatomy. I managed it by giving Anvasan with goblet, but any modification we can do so that weight loss is also there and no complications also.
Nowadays we are not using the Usha. One thing is the Ushakadikana dravyas are not available in the Shodhita form in the market. The first thing is you have to do Shodhana for yourself, which would take around 7 to 10 days, because some needs to be given Bhavana with the Nimbusvarasa, some need to be given Bhavana with the Nagavalisvarasa. It will take only Shodhita, Shilajutu and Tutta are available in market. The rest drugs are not available in Ushakadikana. So if you have really prepared it, the Shodhana is done and the drug is used, because there is no practice of using 24 to 30 grams of Ushakadikana nowadays. We have limited. See how the Lekhana Basti is formulated. It is with Triflaquata, which is again like very ruksha in nature. And for the Sneha, we usually use the Katutaila and the Murshita Tilataila either in a combination or only the Katutaila if the person has a dominance of Kapha actually. And for Anuvasana also the Katutaila is used. Again, that is comparatively little ruksha. But gripping pains in the abdomen are very, very common when you give the Lekhana Bastis because of the Trifula. It contains Haritake. So patient develops the pain, and if any amount of the medicine is retained, they will have lot of bowel movements after the Basti, like 5-6 bowel movements. And when that happens, with a smaller quantity of the Basti Dravya being expelled, it causes the rectal mucosal irritation, then the burning sensation, and sometimes the inflammation starts actually. The thing is, like we have to really standardize. It's need for standardization of the Lekhana Basti. Probably we have to start with the animal experimentation of using so much quantity of the Ushakadikana and then get into the clinical practice. Because till now, whatever the researchers have done on the Lekhana Basti, they have not used more than 3 grams or 5 grams. They have not used the Ushakadikana in the Basti.
Those of Karanj Tel Matra Basti.
Sir?
As a Karanj Tel Matra Basti. Karanj Tel Matra Basti.
Karanj Telamatra Basti in?
As a Kumigna.
As a? Krimigna. Karancha Taila Matra Basti, I don't have the practical experience of using it as a Krimihara Basti. Krimihara Basti is explained with the Pippali and Sarshapa Kalka in Prasita Yogiya Siddhi of Charakasar in Karnataka. That is readily available in market with one pharmacy. Krimihara Bastis, and that is also a treatment of choice in Prameha. For example, any Prameha disease person having the Vata Vyadhi needs to be treated with the Basti, because usually what happens is the blood sugar levels fluctuate when we start giving or administering lot of Anuvasana Bastis. So that is one good choice I felt for the clinical practice. I don't have, because Karancha Taila also, I don't know whether it's used, sir. Have you tried?
After giving 20 ml dose, patient vomits sometimes.
Because if you look into the Krimi Chikitsa, it's a very good point to understand actually, the Krimi Chikitsa, whatever. It is on a single day they have told the Vamana, followed by Virechana, followed by the Anuvasana, followed by Niruha. It is on a single day. In the Krimi management, if you properly go through the Krimi Chikitsa, in the morning Vamana, then after some time, like sometimes the Ubayato Bhagahara Dravya should be given for Krimi management. So after the Vamana stops, the Virechana will start. Then usually the Anuvasana Basti should be given, followed by the Niruha Basti is the principle in Krimi, which is not followed nowadays. And Krimi, I think with the development, the people started using the footwears, and by the use of like the toilets, now the infestation of Krimi has really come down. Very rarely we see the patients with Krimi actually. Earlier, when for the children the antihelminthic drugs were given, literally they could notice the movement of lot of the Krimis in the bowel movements. But nowadays, even if the children are regularly given the antihelminthics, we don't see them. Maybe because of the quality, the food preservatives and all those things has improved a lot. And mainly the worm infestation happens when you walk barefoot, and when you have a lot of cracks in the feet, it is common. And because of the unhygienic atmosphere, nowadays it is less.
There was a slide regarding the drying of Basti. and kept it for some time.
Yes.
So how long you have kept it? What was the method used?
I mentioned it, sir. We have kept it in a freezer dried method was used for dehydrating the sample, and we have kept it for 15 hours to totally rehydrate and to make it a form of completely the powders and the crystals. And afterwards, we kept it in an airtight container for about 2 months. After 2 months, when we checked like physical examination, when it was done, like it was not having any bad smell or the sample was not spoiled. But no antimicrobial studies were done. It was only done as a part of a PG activity to make the PG students aware of the preparation and the story. But I think the toxicity study should happen, and we should try it with the animal experimentation first before introducing it to the humans. Because last time we wanted to put a project to RGUHS for the grant actually related to this instant basti pouches. But the advisor said you have to first take it up for the animal study. Toxicity study needs to be done.
And there is any differences in the action computation in different types of Basti preparation?
Sir, actually the retention period may not vary depending on whether you put it in a mixer or you put it in a churner or any other methods if you are using. The retention period may not vary. The retention period varies if the quantities of the Basti Dravyas are different. For example, classically prepared Basti Dravya, as it is little thick compared to what we are preparing today, the retention period is good. Especially when it is administered in the Putaka method, it gets retained for a longer duration. But the absorption will be different. For example, the mixer you saw, there is no stability. And how the stability comes, it is because of the particle size and its uniform spreading. Once the particle size is less, it becomes a nanoparticle. It will resist any changes with respect to the weather or the atmosphere for a more duration. So when you prepare it by the Kalva method, usually particle size reduces in a better way compared to the mixer or the churner method. So better absorption we can think of.